Good morning, everyone. So yesterday we had started a discussion on issues related to healthcare sector in India and what are the various suggestions and government interventions that are taking place. So we had discussed issues related to health management, wherein we talked about the low percentage of GDP that goes into our healthcare, which becomes a barrier to achieving universal health coverage. Then we were talking about issues related to human resource, that we do not have sufficient human resource, and the rate at which our human resource, that is your doctors, nursing staff, etc., is growing is low compared to the rate of population growth. Similarly, we talked about various quality issues, etc. Now, we were talking about curative measures after preventive measures, wherein we discussed sanitation, cleanliness, and we discussed other issues. So the next topic that we have to take up is organ donation. That we see in India, very few number of people actually go for organ donation. Organ donation is basically donating an organ to someone, to a patient, which is in healthy state. The organ that you have to donate has to be healthy, for that matter. Now it can take various forms. It can be, for instance, kidney transplant, because see, there are essential organs as well which can be donated, but they can be donated if the person is on the deathbed and their organ is healthy. Otherwise, you see that there can be donations that take place even when the person is alive. For instance, a family member donating one of their kidney to another family member to save their life, because they can function on one kidney. But if the family member needs one, then providing one. In India, if you look at the organ donation, it is only 0.16 people per million people who donate their organs. Even though you might find it that it is the process, yes, has a little problem, but otherwise it is generally because of various socio-cultural issues and the sense of responsibility a person has towards the society. These become the primary reason that organ donation does not take place at the scale it is required, because we always find there is a gap with respect to organ donation. People need the number of organs that people need every year is way too more than the supply, is way too more than the number of people who donate organs. And now, if you can think of your religious reasons that a body is not supposed to be, and you find it in the case of postmortem as well, that people protest not to go for postmortem, reason being religious. Then we also, in a sense, do not have a sense of accountability towards our society. We are supposed to understand that it is something that can be done, because it's a simple thing that you just fill the form, give your consent that before you die, or maybe if you die accidentally, all the organs that are in healthy state can be taken up, because it will fill in that gap. But we do not have that sense of responsibility towards our society. We do not feel like helping others. Then also the reason can be lack of awareness with respect to organ donation. That organ donation is something that is not making any difference to the person who is on the deathbed or is deceased, and it should be totally normal to donate organs, as how we see in Western countries that the numbers are way too high compared to India. For instance, you look at US, it is 27 people who donate organs per million people compared to the Indian number. Now, because of this demand and supply gap, you find there are issues related to organ donation. One issue is that people do not come up, people do not proactively take up organ donation, even though you'll find a lot of drives from various NGOs. Even government promotes the same, but a lot of people do not do that. Now, because of this demand and supply gap, you find issues like uh, organ trafficking. Now, this organ trafficking takes place because there is this demand and supply gap, and there are people who want to make monetary benefit out of it. And it also takes place because of the reason of poverty, because poor people might feel that this is something that will be ultimately a security for their family. And you would have seen movies, you would have seen cases in news, if not just respect to organ donation, but with respect to blood donation particularly, that how poorer people in the cities go for blood donation, even though the stability time is 3 months, but they go for blood donation every week or in 15 days, a month. Reason being to get monetary benefit out of it. Now, also we see that our regulatory framework with respect to organ donation is weak. This also becomes a reason for trafficking. Then also you find when we talk about organ donation that we do not have adequate facilities. Even if you want to donate organs, generally you find that we do not have adequate facilities for that transplant to happen, transplant to take place. We do not have proper storage facilities so that the organ can be put to good use. So these are a few issues that happen with respect to organ donation, and trafficking being one of the biggest issues these days. And India has become a premium destination with respect to organ trafficking. That a lot of people in the West actually go for organs which have been trafficked from India. Why? Because they're cheaper, because of the poor population that we have. Then also we find that we have more and more number of people available. Also, the regulatory framework is weak. Now, these become the reason for organ trafficking to take place. Now, what can be done? One is that people have to be made aware. If you spread awareness with respect to organ donation, that it is not a problem. Like for instance, with respect to blood donation, you find Red Cross Society working in each and every district, and they promote blood donation, and they promote it saying that yes, this is healthy. Yes, it's not going to be a problem for you. Similarly, there have to be awareness campaigns drives to make people aware about the benefits of organ donation, the benefits of organ donation that ultimately the society is going to reap. Now, to stop organ trafficking, you have this act that you can remember, that you can just let it be mentioned here, and when you revise, if you go through it once or twice, you will be able to remember. Social religious reasons can be take example of Hinduism, that if one's body, if the organs are say removed from the body, one would not achieve moksha. That is the ultimate stage. So these become the reason that people stay away from organ donation. Now, apart from this, apart from the various other curative measures that we are talking about, now you can think in terms of various communicable and non-communicable diseases, and we have already seen the data that the burden with respect to non-communicable diseases is high in India. And what we have to do is we just have to see that there are various diseases, both communicable and non-communicable, and what the government is doing for the same. For example, dedicated plan for tuberculosis, and tuberculosis becomes a reason is another issue because of multi-drug resistance. Then you find various awareness drives before monsoons, during monsoons, to prevent issues like malaria spreading. Then also you have new impetus towards or new focus towards preventing these lifestyle diseases like obesity, overnutrition. So government in form of your various campaigns, the push towards yoga, is trying to prevent these lifestyle diseases as well. So you have various programs and policies, and you can mention a couple of examples that would do, because the chances are very few that they will ask a specific question on this. Then if we talk about the affordability aspect, and we were talking about one was out of pocket expenditure, then we in that we were saying that it is your medicines which actually take the major portion. It is your medicines wherein people are investing most amount of money. So to decrease that out of pocket expenditure, we're talking about universal health coverage, we're talking about increasing expenditure on public healthcare system. Then we are talking about regulating your private sector so that they do not charge a lot. Then also we had discussed about insurance. Now another aspect is compulsory licensing. Think of a medicine A which has a very high price in India, and generally it happens because the company which has patented either the medicine or the process with which the medicine is made, they have a monopoly with respect to the product, with respect to the process, and they consider these high inflated charges to be basically the cost for the research and development that they had involved themselves in. And we see that research and development R&D takes a lot of resources for that matter. And if a private company is getting into research and development, they have a right with respect to charging the amount that they deem fit. But at times we find that in cases of national emergency, for instance, COVID. So what happens is, not if there is an epidemic, not everyone will be able to afford that medicine, and which will not be fair, which will not be just to the people who are not able to afford the medicine. So in those cases, the government grant compulsory license. That means basically you can license companies, domestic companies, to prepare to produce that medicine or to use the same process to produce that medicine without informing the patenter. The one who has patented that particular product or the process need not be informed. But it cannot be done for profit making purposes. Because say if the product A is say 50 rupees and you create another product violating their IPR, violating their intellectual property rights, and start selling it for 5 rupees, then it is not fair to this company who had produced that, who had worked on this product in the first place. So it cannot be used for making profit. It can be used in times of national emergencies, etc. So these are a few. You can just go through this. We have given examples here. These are a few problems and the suggestions with respect to various issues that we have seen. Now, what we have done so far is, now the suggestion part is actually coming from the same discussion we had. Now, what we did was we discussed problems related to health management. Then we talked about preventive and curative measures taken up by government. Now, what we have done is we have basically worked out these problems in the framework of national health policy, and I hope that you did take out time to go through it yesterday. Now, one idea is that even though government has been investing in these dimensions, government has been trying to say keep the society clean or keep with your Swachh Bharat Abhiyan, for instance, which is preventive in nature. Government is trying to tackle pollution. Government is trying to make medicines and healthcare affordable, but still we find there are a lot of gaps. Now, what can be the suggestions for the same? So what we have to do here is, now you can easily understand what we have to do is that we have to broadly classify the areas, the dimensions in which we need suggestions. Now, we were talking about the affordability, for instance. We were talking about the investment of government in healthcare. Then we're talking about the role of private players. Now, if we talk about, say, financing, and it can be divided in two parts. These can be various suggestions that you have. And also what we have done is we have given a split of these suggestions in the upcoming slides. So it can be divided into two aspects. One is financing healthcare in India. Then the other aspect is protecting the consumer with respect to prices. So one can be, say, in terms of investment or financing healthcare. Then the other one is protecting the consumer. Now, if we talk about investment, what we had discussed, that either we increase the amount that goes into healthcare, public expenditure can be increased. Then the other idea was that we can give a push towards privatization. Now, with respect to privatization, we had highlighted a few issues. That with privatization, it will be profit oriented. And with privatization, they will end up monopolizing the market, the bigger players at least. And we see that wherever, in whichever city you find those big institutions, big private hospitals, they generally push these, say, private clinics that work on a smaller scale aside. And they take over the entire market with the resources that they have, with the resources to invest in healthcare and with the resources to market their services, which becomes a problem. So what can be done? Now, according to you, what can be the solution? Now, with respect to protecting the consumer, we have already seen various ways. It can be insurance, it can be compulsory licensing, then it can be extending universal health coverage. Now, what can be the solutions for the problems we have with respect to privatization? Because one idea is that to increase public expenditure. That works. That helps in investing in healthcare so that in future we can, say, achieve universal health coverage. But what can be the solutions? What can be the suggestions with respect to the negatives that we find in terms of private sector? So yes, one that you're suggesting is public-private partnership, wherein the private players and the government work hand in hand to remove these issues. And also there seems to be, when we say that these private hospitals are always going to be profit oriented, we see that there happens to be a trust deficit with respect to private players. That we always say that they are into profit making, but we do find positive examples from here. We do find examples of companies which do CSR even though they're not mandated to. Then we also find private organizations working hand in hand with your NGOs, with government, to spread awareness, for instance, to provide medicines. And you have examples for that. So this trust deficit that we have with respect to private players has to be reduced, because we cannot say ask the private players to invest and not trust them at the same time. Now, with respect to privatization, we were talking about the cost, affordability becoming a problem. Then to check affordability, what we can do is we can regulate. We can have, the government can have a ceiling with respect to the prices that the private hospitals can charge, and they can also demand more and more transparency with respect to their pricing standards. Then also, if we talk about this, you find that these private hospitals are generally located in urban areas. and most of the health practitioners are also available in your urban areas, and we find the issue related to access in rural areas. So what can be done to incentivize them to start and to set up hospitals in rural areas so that rural people can also benefit out of it, and we do not see this rural urban divide. Then also having a push towards your medical colleges and hospitals, which can be pushed into not just rural areas but other suburban areas as well. Then doctors have to be incentivized to work in rural areas, and not just incentivized. At times there can be coercion in the form of compulsory posting, compulsory rural posting. So if you say, and these examples you need not remember, everything has been mentioned previously in the slide. So why are we doing this? So that we have everything. We have all these dimensions in one place, because if they ask about one particular dimension, say they say what are the issues related to human resources in healthcare sector and what can be the solution for the same, for instance, so you remember and you do not have a problem structuring your answer. Okay, so incentivizing, like providing rebate in taxes, yes. Then there can be incentives linked to research, because we see that in research as well we do not invest a lot in India. So auditing mechanism for private sector would ensure transparency and trust, yes. So yes, we can implement better manufacturing practices. So these ideas you can think, then you can talk about, say, your human resource. Now the problems with human resource are less in number, poor quality, urban rural divide, then there is regional divide as well. And also we see that the educational institutions and training institutions are not many in number, and we have already seen the government intervention for the same. What can be the other solutions? What can be the other suggestions with respect to human resource for health? Yes, so see, Avinash, when we say that we have to increase the number of beds in hospitals, it is part of financing your healthcare system. It comes with it. So what can be the suggestions to improve the status of human resources in healthcare? Yes, so we can have a body to look after the process. Yes, opening up of more number of institutions, improving the quality of education, providing professional skills to the healthcare workers. Then also there is a good idea that the idea of first aid and primary healthcare has to be pushed in the public as well, so that at least the bare minimum, the basics, can be taken care of by people. And if you remember, during your school days, maybe you would have had those first aid drives wherein they teach you, wherein they make you aware that how you can actually deal with a problem, and you can say deal with the problem till there is professional support from the healthcare system. Then yes, there have to be, say, exams even after they are in services. Reducing the cost of medical education, because one idea is increasing the number of colleges so that you have increased access. Then removing the urban rural divide. Then the third aspect is affordability. So to make them affordable, one is you can provide scholarships to at least the uh, sections who are backward in that sense. Then you can also regulate the pricing mechanism. You can have an overarching body which looks into these aspects. Yes, so regulating more, because there are people there are doctors who work who are engaged in both private and public service. So we have to make sure that our government institutions do not they have an accountability mechanism. The people or the healthcare workers do not just stay absent from those facilities and work in their private clinics or work with other private hospitals. So yes, this is something that can be discussed. Now there can be other ideas about community participation and citizen engagement that we are discussing, that people need to participate in various ways, because it is not just with respect to providing curative healthcare. Because what we think of healthcare is that, okay, ultimately someone has to provide, say, someone has to operate someone, or someone has to a physician or say registered doctor to help with healthcare. Because if you remember, when we're talking about determinants of health, it was nutrition and various lifestyle changes that actually impact health more. And it is only 10 to 15% of healthcare which matters. So yes, if we take preventive measures, if we take promotional measures, or rather promotive measures, it is going to help. For which you have to make the public, the general public, participate in this process. Then we have also discussed regarding the access to medicines, various vaccines, investing in research and development. Then you can see that pretty much all the dimensions which have been mentioned here can be covered easily. Yes, so bringing in emotional quotient in healthcare, increase trust between citizens and public healthcare. Yes, so the way we find that people do not want to go for public healthcare, people do not want to government hospitals, people do not have faith in your government doctors, apart from the bigger institutions like AIIMS, etc. You generally find people stay away from public healthcare, and this applies to us as well. Even we would not want to go to a public hospital in case of any emergency. So if only we do not have an option, we would say, okay, let's go to a public healthcare center. Otherwise, generally we stay away from them. So this trust deficit has to be bridged. Okay, so with respect to including ethics classes, it is already there. So they already study that. Okay, in private hospitals, yes. Now then you can also talk about the role of digitization, the role that digitization can play, because we have this issue with respect to access. People are not able to access healthcare services. So providing healthcare services at doorstep, then it can be with respect to digitizing all the records, digitizing the personal information of a patient. And also, if you remember, we had discussed a few issues. And I hope everyone went through the PPT as well during the revision, because there might be a couple of points that get missed during the discussion, and those are mentioned here. So these can be the ones. Let's do one thing. This is something that you have already seen, already discussed, and you'll find various ideas mentioned here that you can just go through once. So these basically relate to all the dimensions that are there. So for instance, if we talk about financing and protection, you have these pointers here. So these can be looked into. You just have to look into them once. Then what we do is, let's think about what kind of questions can be asked. What kind of questions can be asked? So a simple question can be that what are the impediments to providing universal health coverage? Now, universal health coverage, we already know that it is with respect to providing access to healthcare, access to affordable and quality healthcare. So it talks about access to quality, and affordable healthcare. Now, while dealing with this, you also keep in mind that iron triangle that was basically with respect to access, affordability, and quality. That if you make changes in one of these factors, it impacts at least one of the other factor. So if you want to say increase the quality, then the cost has to go up. If you want to say provide access, if you want to make it accessible, then again quality would have to suffer. So this is something that you have to keep in mind, so that whenever we come up with suggestions, we are realistic and practical about them. Because it is very easy to write in the policy document objective to be provide quality and affordable healthcare to all, but to achieve that is the task is something that looks impractical. Yes, so for instance, we're asking about technology. You can definitely talk about say stem cell banks. You can also talk about the role of artificial intelligence in healthcare. Yes, you can definitely use these examples. So this is basically called iron triangle of health, but you need not remember the name. You can just mention the idea about it. You need not remember the name. It is called iron triangle, but you can just remember the idea. Even if you do not mention it, you just remember the idea that we have to be practical with respect to our suggestions. Now, let's get back to the question. So the question says, what are the impediments to achieving universal healthcare in India? Because this can be one idea. Your policy talks about the same, providing access to all, providing universal health coverage, and this is something which relates to your human development as well. It is considered to be one of the natural rights that a person has. So what can be the impediments with respect to universal health coverage? And also, when we are talking about social issues, I just want to make one thing clear. That when we are talking about social issues, you see that you pretty much touch every dimension. That you touch science and technology, you touch polity, then geography, and all the other dimensions. Now, what you have to remember is that when writing an answer or looking at a question, you have to be careful that what has to go into it. So we cannot say completely make our answer say biased towards science and technology, towards role of science and technology, or just towards the role of say policy making. So we always have to strike that perfect balance that all the dimensions are covered. Because even if you just mention the dimensions and a few instances with respect to that, that would pretty much make your answer good. And also, we are trying to make our answers more and more specific. But also, you'll see that there'll be questions wherein you would not have a definite answer. So, for instance, there is a question here. Just we'll get back to it. Let's look at this question here. So, a policy is as good as its implementation. That a policy, no matter how much goes into the planning, how much goes into the evaluation, what are the factors with respect to policy analysis, no matter how much you invest in designing that policy, but as long as you're not able to implement it, it is a failure. So, similarly, think about this statement as one related to outcome. So if you're not able to process your policy properly, that is the implementation part, you're not going to get better outcome. It is going to be a failure. Now, in light of this, we have to critically analyze the National Health Policy 2017. Now, one idea is, yes, you can have a simple critical analysis of various aspects of National Health Policy, and that you have to do yourself. This is a practice question for you. Because if you go through the internet, if you look at various articles that have been published, critically analyzing the National Health Policy, and even though the idea is old, because they would not ask a question on critical analysis of National Health Policy right now, but they can definitely ask a question on the implementation part of it. Because now it has already been 6 years, and let's see how our policy is doing. Let's see what are the problems, what have been the outcomes. Now, if you look at a question like this, you will not have the complete data because no one can possibly remember the same. Yes, you'll definitely find data with respect to the increasing number of colleges, what the government has done, for instance, how successful government has been in making healthcare affordable. Now, that you have to also look into the idea of access, because if you see recently there was this report on wellness centers under Ayushman Bharat, that most of the states, a good number of states, have achieved the target for access, that they have set up those number, the mandated number of health and wellness centers. But then there are states who are doing poorly. So what about making it equitable? Because the policy document talks about the same. So when you have to say address this question, it will have say will have to use general ideas. You have to use general ideas. You have to break it down and use general arguments with respect to this, because you cannot possibly remember all the provisions of all the policies, and then you cannot possibly be aware of everything that is happening around. Because a lot of reports with respect to say healthcare do not even get published in the newspaper. Then how do you expect to know about it? Then also at times there are reports which are not given due weightage. And if you look at government data, if you look at evaluation of the schemes by the government, you will always find it in a very positive light. But they do ask questions wherein they ask you to critically analyze the policies. So what do? You use the general rules and go about it. And with respect to policy making, implementation, design, etc., we will discuss in the last chapter. But till then, why? Because we could have kept it at the beginning as well. But why are we doing this? So that by the time we reach that concept, you already have created a framework in your mind. You already have been working on these type of questions. So if you look at say this health policy, then you can talk about various schemes. How are they faring? So these type of questions have already been addressed. So it will be easier for you to understand later. Okay. So but I was saying is that with respect to social issues, let's try to make our answers balanced, because you will have a limited say slot to write your answers, and even in paper 2 social justice you will have limited number of words to write your answers, and you'll have sufficient content because you take from every subject. But we have to make sure that the answer is balanced. Okay, let's getting back to our question. What are the impediments to achieving health for all or universal health coverage in India? So the first thing that you do about this question is think about the dimensions of universal health coverage. That universal health coverage will talk about access, because it is universal when it is available to all. Then it will talk about affordability, because you might have a hospital in your area, but if it is not available, if it is not affordable, if the prices are too high, then the purpose is defeated. Then also, if the quality of healthcare is not good, then also it becomes a problem. Now, with respect to these three dimensions, what do you think that are the problems? So rather than say structuring it, because you could have structured it in terms of financing, etc., but rather than doing that, take up these dimensions, which basically relate to universal health coverage, because these are the ideas which actually mean universal health coverage. So take up these and then start dissecting it. Then start looking into what are the problems. So can you suggest how access can be an impediment? So, yes, so on a general level, you're suggesting that cooperation between states and center is a problem because it is a state subject. Okay, so we're not talking about suggestions. We're not talking about suggestions. We're talking about the problems. What are the problems that we are facing in achieving universal health coverage? So yes, geography can be one reason. Then the rural-urban divide. Great. Then what comes in the way in providing this access? Your financing becomes a problem. Yes. Lack of interest shown by private players. Great. Right now we're talking about access. So poverty can be mentioned under affordability. Okay, so you can think about access and you are in the right direction. Then you can talk about the affordability aspect. That how is it becoming a problem? So here you can mention data from your out-of-pocket expenditure. Then you can mention about how the insurance schemes are actually not working. Because even if yes, you might get insured for the for other medical facilities, but you do not have this various other charges which are covered under insurance. So one is people do not have insurance. Then think of dental care; it is not covered under insurance. Then also, if we talk about yes, we do have public healthcare centers, we do have government hospitals, but again, generally they do not. You will find that the free medicines and the cheap medicines that we're talking about are generally not available. So that also becomes a problem because if you have to say go for an X-ray, if you have to go for say ultrasound, you generally have to run for private laboratories, so which also becomes a problem. So lack of social security to people, you can mention it like that. Yes. So prices of medicines, etc. Great. So the point that you've written that doctors are not willing to serve in rural areas, let's mention that in access. Let's mention that in access. Then you can think about the quality of the healthcare that is being provided. Right. So I hope you can. I hope you can take up these dimensions and answer the question. Now, what has to be done is if the question says that what are the various impediments in providing or in achieving universal health coverage in India, then you briefly in one line in the introduction mention about UHC, what it entails. Then it talks about providing access to quality and affordable healthcare. Then you jump straight into the problems. What are the gaps that need to be filled? And ultimately, in the conclusion part, to give a way forward in a line or two that what can be done to improve on these aspects. And there you can, to make it sound even better, you can quote directly from your health policy. And even though whatever suggestions and problems we have looked into, they have been taken up from your health policy, whereas it is better to mention that the government is working in this direction of universal health coverage as an objective under the national health policy. And they are talking about, just mention briefly, 2, 3, 4 points, and that would do. So this is one question. I hope you understand. Now, similarly, this was with respect to universal health coverage, an element out of your national health policy. Then one question that you have to do yourself is the implementation part of national health policy, because you do not know what is happening in every dimension. So if you find something, and this is going to be the same with your national education policy, because the question that they have asked so far was they already have asked a question on national education policy, but that question was not directed towards implementation. And now again, it has been 3 years since your national education policy came into being. Now we have to see what is happening in each and every area, and this is going to be a process. So when you find say something related to national education policy in the news, for example, with respect to your NTA, National Testing Agency, taking up the Central University entrance test. So you mentioned that because it is one step in the towards implementation or towards achieving the we have to talk. Now, what we can do is another idea is your question can be directed towards a section of the society. How? Healthcare for elderly. What are the various issues and solutions for healthcare for the elderly, for providing healthcare to the elderly? Now, how do you think about it is so you're asking that when we talk about the previous question, access, affordability, etc., do we have to write all the problems and all the solutions? No, you possibly cannot. So you have to take up the major ones, prioritize them, and you do not have to write the solution in the body part. You just write the suggestions during conclusion because the question was talking about what are the problems. It did not ask about solution. So let's keep the solution or keep the suggestion or way forward for the conclusion part. Now, what do we do about this question? Wherein we have to talk about the problems related to healthcare or problems related to providing healthcare to the elderly, because we're not talking about the health issues of elderly, but talking about problems that elderly face with respect to this. Now, if you remember, again, you can use the same logic, same framework of access, affordability, and quality to highlight the problems. That what are the problems in these dimensions? If you remember, we're talking about geriatric care, that we do not have sufficient practitioners of the same. So let's see how do you go about it. So what can be the problems with respect to access of healthcare, access to healthcare for elderly? Let's highlight the problems first. Let's wait for the suggestions. Let's highlight the problems first. Ilma Mritunjay, you're talking about these suggestions. Let's stick to the problems first. So okay, just think about this. A lot of our elderly need healthcare. That is one dimension. That is one aspect. That a lot of our elderly need healthcare, and it need not just be tertiary care. It has to be say a caretaker. Because if they are alone at home, how do they take care of themselves? So need access in that regard. So access with respect to doorstep access to healthcare, because they possibly cannot travel all the way to say urban areas to access healthcare. So non-availability of doorstep access. What can be the other idea? Then yes, elderly deal with a lot of health issues because of isolation, mental health issues, isolation. Then you have problem with respect to dementia, that they have say a tendency to lose their memory as one grows older. So you can talk about the mental health aspect, that how we do not have sufficient mental health practitioners. Then elderly, yes, they can have physical impediments to movement, to mobility. So non-availability of basic infrastructure for their mobility. So one example can be access to wheelchair. Then it can be access to various public places. For instance, dementia is the disease wherein one goes on losing memory as they age. So okay, availability of various basic infrastructure for mobility like ambulance. Great. Okay, now then with respect to affordability, the first problem is that the elderly are not financially independent. They are dependent on generally they are dependent on someone else for all their financial needs. So with that, at the cost of care, because one idea with respect to access is that access is limited and there is a disparity in terms of access. So you have hospitals in urban areas, but you do not have many healthcare centers in rural areas. So with respect to affordability, you can think in terms of private care, and you can also yes, financial insecurity is there. Okay, then what you can do in this question is when you talk about these affordability as well, that you see with respect to access and affordability both, that they need follow-ups, because if, and generally you'll find a lot of elderly will have problems which persist for a long time. So for example, their health with respect to heart, so they will develop some or the other disease with respect to the heart, and for that they need follow-ups to the hospital by the doctor. Now one is the issue with access, then the other issue becomes affordability. Then if you think about solutions for the same, and when we talk about quality, now there are a few points that you have mentioned previously. So one, quality healthcare not available, can be physical healthcare, can be mental healthcare. Then also quality is compromised because of limited doctor to patient ratio. Then attitude of healthcare workers, people are not sensitive towards the needs of the elderly. So not just people, and particularly healthcare workers have, they are not sensitive towards the needs of the elderly. So that becomes a problem. Low quality healthcare provided by our public hospitals or public healthcare institutions. Right. Now, one is if you want to achieve approach this question, one is that you break it up like this. Another idea can be with respect to various dimensions of their life. And herein we will particularly talk about the problems that they face. But in that case, we're not breaking it down into parts. Then we have to say move in an unstructured way. So if you think about what are the problems that elderly face with respect to health and you try to address those, then it will look a little unstructured. So it is better, in my opinion, to break it down into these dimensions and approach, because it makes your task easier. And you do not have to write it there. You just have to create the structure in mind, so that you just go on with points related to access. Then you move on to affordability and quality. Because at times what will happen is you might a good point might come up in your mind later. So if you say create a fixed framework that okay, first we'll talk about access, then affordability, quality, then it becomes a problem, because then how do you add that point there? Then you would have to either miss out on that point or add it somewhere else. I do not have that kind of time to figure out that how to say approach this particular dimension, keeping in mind affordability, for instance. So it's better you keep this framework in mind, follow this, do not write it, do not make those compartments. You write those, and if something comes up later, you can mention that as well. So affordability is financial status of the elderly. That if you think about old people, they do not have any say means of employment. They are financially dependent on the family. Then the prices with respect to various healthcare services that are provided, and particularly with elderly, you'll find one is that they'll need a lot of diagnostic tests that have to happen. So basic monitoring of the body, basic healthcare checkup, which has to be done at a certain frequency, say 2 months, 3 months. And then also if they get any major disease, then it becomes a problem. So yes, you can think in terms of affordability like that. Yes, so routine checkups, high out of pocket expenditure. Yes. So that's how you can approach this and mention suggestions at the end. So this can be one dimension. Then other idea can be women. Then it can be children as well. So when we talk about women, then you have to think in terms of women specific problem. Now with elderly, there was a restriction on mobility, so you need doorstep services. Now when it will come to women, you would have to say focus more towards maternal health, right? With respect to pregnancy, that there is lack of awareness, for instance, with the idea being nutrition, the idea being taking care of the child, etc. So the ideas will change a little. Yes, affordability is going to remain the same, that it is expensive, etc. But then you have to cater to women specific issues. That during pregnancy you have to go for routine checkups. Here the routine checkups are with respect to general health or with respect to specific problem that they might develop. But then when it comes to women, the idea is different. So you can use the same framework, and I have shown you this. We use two, three questions. We use the same framework, and we were able to achieve the solution. Because more often than not, the question that you will find in the examination will be something that you haven't gone through, that you haven't read, that you haven't faced previously. So it is better to have general frameworks for answers. Because when it will come to policy implementation, I'll discuss that framework in the next class. Because that same framework can be used for various policies. Because you might not remember what was there in the newspaper. You might not remember what were the numbers. So it is always better to break it down in a structure and proceed with that. So yes. So price comes under financial, but again, so it is something with respect to affordability. Now, financial status of the elderly is one idea, and the prices of the healthcare services is another. They both come under affordability. Then you can think in terms of medicines, because after a certain age, it becomes a regular thing. Because right now, when you are young, you need medicines only if you develop a disease or if there is any ailment. But at the older ages, you will need to have the medicines daily. So that adds to the expenditure on healthcare. And the major expenditure in the olden ages is actually on healthcare. And you can think of that. You can think of that in terms of your parents if they are old enough, or your grandparents, that how much goes into in monetary terms goes into the healthcare every month, and which is a good number. Then also if you think about affordability, you can think of solution as insurance. But if you talk about insurance, the premiums are so high for those private insurances that it is something that they cannot possibly take up, because the premiums go on increasing with age. The healthcare premiums, if anyone has a policy or has an idea about it, the premiums will go on increasing with age. So that also becomes a problem. So yes, the attitude of the hospital staff and the society at large, because in urban areas we see that everyone is busy or engaged in their own work. And you'll find that if there is a problem, because elderly for that matter are more vulnerable. So if there is a problem, people do not tend to help each other in general. Yes, there are people who will, good Samaritans, who will come up for helping people, but in general, people do not. And think about modernization and the improving status of women. Now, can anyone think that with improving status of women, the elderly are being impacted adversely? How do you think with the increasing or the bettering of status of women, elderly are getting impacted adversely? Yes, Mritunjay, on point. Let's see if others can think about it. Okay, great. So Deepika, Mrityunjay, you are in the right direction. Jatin as well. So traditionally, it was the women who used to take care of her in-laws because she was primarily dealing with household responsibilities. Now, once she has started going out to work, who takes care of the elderly? Because yes, we do have, and if you remember, we had mentioned this point when we are talking about problems, issues related to elderly, that the way we have daycare centers for children, we can have daycare centers for elderly as well. Great. So yes, so what we have to do is when we talk about healthcare, there can be two ways. Because why are we writing this? Because initially I said that it has to be about policy framework. The questions are directed there, but you see that elderly form a part of your vulnerable sections. That is also there in paper 2. Health is also there in paper 2. So the chances are that they can ask, because now you have to see what are the upcoming, what are the problems that we are facing today, and that comes from demography. That the problem is that of aging. The problem is that of decreasing sex ratio. So these are the problems which have to be addressed, right? So they have to be addressed to healthcare, they have to be addressed to education, they have to be addressed to making an impact on the society at large. So you keep the issues that are there, the central issues that we are facing, India as a country is facing today, you keep them and keep opening up the dimensions, because then you can find a question with respect to this, maybe the role of technology in, say, betterment of whether technology can help elderly, for instance. Now it can be asked in paper 3 as well, because the question will be directed on technology. So we have to see that a question can be asked in any paper if it has relations, but the direction has to be different. But particularly when we talk about paper 1 and the social justice, it has to be multidimensional approach. So I hope you got a fair idea with respect to these questions, universal health coverage, how we can improve healthcare for the elderly. Then this is a question. This is a question that you have to try to answer yourself, and try to answer it before Monday, because probably on Monday or Tuesday we'll take up the policy analysis part, take up the design implementation part. So it's better you do it beforehand, because once you do that, then you will have at least the ground rules to focus on this question. But try doing it before that, so that you can storm your brain to answer this question. Okay, so with this we conclude our discussion on healthcare, and I hope everything is clear. Yes, there was a lot of factual information, but it will come naturally once you have revised it once or twice. And also keep yourself updated, keep your notes updated with respect to various developments happening in the healthcare sector. Then the next topic is education and human resources. Now, with respect to human resources, what we have done is human resources for health, dead separately. Human resources with respect to education will be dead here. Then apart from this, we will talk about skill development. That is your human resources in general. So we will discuss two say sector specific human resources, and then we will talk about general human resources. The email ID is written here, and also the there was someone, I forgot the name, who wants to know about the book list with respect to optional paper and how to approach it. You can drop me a mail here, because it would be unfair to discuss optional content here, because the people who are not from the same background. Okay, so let's start with the education. What we're going to do is here as well, we will highlight the issues, and then think of suggestions in terms of your national education policy. And again, national education policies, you just do remember to go through various provisions under national education policy. Pretty much everything is here on the slide, but also the slide to just read it once, not the entire national education policy, but the basic provision. You can find it on the website. You can take a PIB for the same. So when we highlight issues, we will talk first about school education, and then we'll talk about higher education later. So we'll divide it in two parts, rather than say talking about the new pedagogical structure, because we do not have concrete say content for the same, because the policies take a long time in implementation, in showing their outcomes, that what is the outcome. So if you make a change, so for instance, you have introduced CUET. Now what changes have been made will take at least 3-4 years to understand, because there might be a few problems related to the same which might not get highlighted right now. It can take time. So yes, what we'll do is we'll look at issues with in relation to school education, then we'll talk about higher education, and then the basic suggestions and the framework is going to be within the area of your national education policy. One question has been directly asked on national education policy, that how national education policy go hand in hand with your sustainable development goal, and what is it that the changes that have been brought about by national education policy, how are they in the right direction. Now the thing is, if they ask a question on education, they tend not to repeat questions. Yes, you have seen exceptions that they have repeated questions, but they tend not to repeat questions. So if there is a question coming from education, it will be directed in another direction. But we have to still read national education policy, because it is going to stay for at least 20 years. So it will be the framework under which we have to work. Now also, what we have to see is, when we are highlighting issues, we will when we talk about school education, we'll talk about ACER report to highlight issues. Then we'll take up other set of problems from the national education policy. Then when we talk about higher education, then one is your problems highlighted by national education policy, and then one is your report by Ministry of Education. So these will be the primary sources to highlight problems, because yes, there can be other problems. There's no denying the fact that there can be other problems that have not been highlighted here. But the thing is, we need to focus on the part, we have to prioritize, right? We cannot keep going through the newspaper and try to look at small issues. So major issues have been highlighted in these reports. So for school education, ACER report, and for higher education, all India survey for higher education. Okay, so this was the question that you have written, that is, examine uniqueness of the tribal knowledge system when compared to mainstream knowledge and culture system. What we'll do is we'll take it up with the vulnerable sections, wherein we'll take up scheduled tribes, what are the problems related to them, what can be the solutions, and the questions asked in the past. Because as discussed now, we will take up more and more questions. We'll try to take up more and more questions for the next 3 lectures, so that you are prepared. Because questions can come on any dimension, because there can be things that have been left untouched. But you should know how to work out the question, because not every question will have a definite answer. And you'll see, I'll show you. So one such question has already been given to you, and then there are other questions that have been asked in the past where you do not have a definite answer. So you have to work out the general framework for that matter. Okay. So one thing is that you remember with respect to education, that you need to know about the national education policy. And also what we'll do is, here you have all the components of national education policy in the PPT, right, in the form of suggestions. What we'll do is we'll look at these suggestions when we look at the issues, and you can just go through these things later. How will you do that? We will discuss. need not worry about it. We will discuss how to go about that. And by the discussion that we had so far, we would have a fair idea how we can approach. Okay, so let's look at questions that have been asked in the past. National education policy is in conformity with the Sustainable Development Goal 4. It intends to restructure and reorient education system in India. Critically examine. Now we have to see that how it is in the direction of Sustainable Development Goal. And if you remember that all the dimensions that we have covered so far are in relation to our Sustainable Development Goals. Because what the basic idea is, yes, we look at national issues that are there in a particular problem, but the broader framework has been decided by the Sustainable Development Goals, wherein all the countries came together and decided that these are the pointers, these are the issues on which we have to work, and that to in a target-based manner. And that's why you see that you have, even though there will be national differences with respect to the provisions of the schemes, with respect to the way they approach it, with respect to the way they implement those policies, but the ideas are similar: cleanliness, education, health, etc. Okay, so a question on relationship between national education policy and Sustainable Development Goal, but it talks about how the restructuring and reorientation of the education system that has been suggested by national education policy, and we have to critically examine that how is it in consonance with Sustainable Development Goals and how it is not. That was the question. Now, yes, it does not say factor in the implementation part. It has more to do with the designs and the basic framework of the policy. So, okay, keep this question in mind and we will discuss it later. Then there's a question on right of children to free and compulsory education. Right to education remains inadequate in promoting incentive-based system for children's education without generating awareness about the importance of schooling. So you can say that this question is directed towards the outcome of your right to education. That yes, it is there, but it is inadequate in terms of generating awareness about the importance of schooling. So this is the direction in which you have to move, thinking about the outcomes. Yes, we are providing free education to all, but what is the outcome? Okay, so these are previous year questions just to give you an idea that how you can think about these questions. And I believe that you must have started getting ideas about the same. Now, starting with our school education, what we said was, one, we'll take up our ASA report, and then we'll also look into problems and issues highlighted by your national education policy. And then we'll try to suggest measures that are there in your national education policy, so that there is a link. Because we have to, as civil servants, understand, as say prospective civil servants, understand that the broader policy framework that is there, we have to work within that. We have to work within that framework. Because you are the ones who are going to implement these policies, and you have to understand that there is a problem, there can be different solutions. For instance, just think about this. For instance, to achieve universal health coverage, it can be, say, complete push towards privatization, that let private sector deal with it, let them provide insurance, we will regulate them, and we will maybe take care of, or the government maybe can take care of, say, a few disadvantaged sections. Now, you have to remember that, when we design policies, it is not just that, okay, we go through a lot of data and we decide that this is how we are going to approach. No, it does not work that way. You have to look for alternatives as well. Now, if I'm going with this way of achieving this objective, so you look at the data, you try to define the objective, and then to approach that objective, you can come up with alternate options. That, let's say, privatization is one way, second way is increasing public expenditure, and the third way is let's keep a mix of both. Now, these alternatives will be evaluated basis projections that what might happen if we go with this. And now these projections are again technical in nature because they will go hand in hand with the data projections, the way you have to analyze data. It is not just abstract thinking of that this might happen. It is not just conceptual. There is, say, technicality involved in it. Now, after all this evaluation, they come up with a policy. That, okay, this is the direction in which we have to move. Now, when you implement the policies, you have to keep that framework in mind. You have to keep those pointers in mind. And similarly, because when it comes to implementation, by that time the rules have already been decided that who's to do what and how one is to do that. But at least at this stage, you have to understand that it has to be the policy framework under which you have to work, right? So, okay, so just remember that we have to suggest, we have to come up with solutions with respect to our national education policy, the way we did in national health policy. So again, it might get a little factual in between, but please bear with it because this is how the nature of the subject is. Okay, so yes, well, the idea that we have written is right, and we will look into it how we have to go about it. So this ASA report is something that your NGO called Pratham comes up with. Now, it is primarily, you remember that it is rural in nature. That one thing is, you look at the extent of it. 616 rural districts are being covered. Close to 7 lakh children in the age group of 3 to 16 are being covered. Now, the extent is great, so whatever numbers they come up with will reflect a true picture. That can be there, that is there. Yes, there can be problems, there can be gaps, but yes, it will be a near true picture because of the size of the survey. Then you have to always remember that it is rural districts. So they're not taking care of the urban areas or the problems that we face in urban areas. So it is primarily rural in nature. Yes, Pratham as an NGO does work in urban areas. They have centers, they have operations in urban areas, but this survey, ASA survey, is not. Then the basic idea is to think about the outcome. That yes, government has been providing various amenities. Then there is this right to education. Then the private sector is also pretty much available everywhere. But what are the outcomes of this? And before outcome, they do look into the input side and the output side, and they talk about first the enrollment in schools, what percentage of children enroll in schools, then what percentage of children actually attend the school, and then they also talk about the dropouts. That because if you see at with the increasing level of education, there is increasing number of dropouts. So not more than 30% will ultimately take higher education. Now, even if we think of enrollment, we might feel that not a lot of students enroll, but things have changed. Now, it is not more than 2% of students who do not enroll in schools. And we'll come to that. We'll come to that. And you do not have to remember hardcore data from here. You just have to remember observations. That what are the observations of the report? Because you cannot possibly remember all the numbers. And then another thing is, wherever there is an exception, try to say highlight it even in your notes, because that is one dimension that can be easily asked in the paper. Then it talk about learning outcomes. Learning outcomes in terms of whether they are able to read, say if they are in standard 5th, whether they are able to read something from standard 4. Then also about their calculation, arithmetic, and basic mathematical skills. So the learning outcome is basic reading and arithmetic skills. So they are focused towards outcome. And also we will think of the shortfall as well. That yes, students are going to the school, they have enrolled, they are attending the classes. Yes, in terms of basic reading and arithmetic skills, they are doing fine. But what about ultimately converting them into a human resource? because we have to think, is this sufficient? Then it also talks about basic facilities that are available in school, basic facilities like library, a computer lab, whether you have proper clean drinking water or not. So these are a few things that they talk about, that the report talks about, and then also talks about the attendance of teachers in school, because particularly in rural areas and your public schools, teacher attendance is a problem. That a lot of teachers do not attend school, and even if they come to the school, there is absenteeism from the classroom. And you would have seen the state of our government schools, and not just in cities, not just in rural areas, but in cities as well. That the moment you pass through a government school from in any area, all you find is that a lot of students are shouting, fighting amongst each other, and that is the general idea that we get when we pass through any government school. And a few of us might have studied from government schools for that matter. So the state of government schools particularly is something that will remain in focus for that matter. So let's look at a few observations from here. Now I've added this graph, these graphs, but you do not have to remember the data from here. Yes, it is not the case with every government school. You will find good, decent government schools. Then you will find good teachers working in government schools, working for the betterment. And I'll give you a personal example, not from a government school, but yes, our teacher for the subject Hindi literature back in school days. The teacher we had, she had dropped from the services. She had cleared civil services back then. She did not join. She did not go for training, and rather took up PhD and teaching school children for that matter. And she was a teacher, Hindi class teacher, and you find a lot of examples like that. Even in government schools, you find people generally passionate about teaching, generally wanting to make change. Then also you have a lot of volunteers working across the country for betterment in education. There are various foundations where people work voluntarily to improve the status of education. Then you can think of Teach for India Foundation. Then you can think of Pratham, for instance. Yes, there can be various examples, various exceptions, but general idea, because this is something that will reflect in the learning outcomes. Because we are talking factually, we are talking with respect to data. So you find that the learning outcomes are not that great. So if we talk about enrollment, now enrollment is not much of an issue, and with respect to this, you find that your national education policy talks about achieving 100% enrollment, 100% enrollment by the year 2025. Why? You can see that it is a very ambitious target, but you see that it is not more than 2% children that are not enrolled in schools today. But yes, in absolute numbers, it is going to be huge. But in terms of proportion, we have been improving year on year. You see that the number of students who are not enrolled is decreasing every year. But then this year, there has been a different trend. Now, this data is coming from 22. This report was published last year, and you see that data is still 21. And you'll find that when we talk about enrollment, the enrollment in government school is increasing. 2014, 2018, and now 2022. So the enrollment in government schools has increased over the past year. Now, can you possibly think of some reason? That why do you think that the enrollment has increased in government schools? Is it that our government schools are getting better and better? They have now better facilities available compared to private schools? Yes, your point, Abhijit, it will be covered. Do not worry. It will be covered with respect to teachers. Yes, so you are working out your suggestions in the right direction. So what you find is that because it can be thought of in terms of COVID impact, that because of COVID, a lot of people lost their livelihood and they had to take out their children from private schools and send them to government schools. Then also it can over the fact that there is a little rising awareness with compared to sending children to school. Yes, because people would not be able to afford. But I'll tell you something. Then there's another data which talks about tuition classes. Now, tuition classes are the classes that you take outside of school. You pay separately and take tuition classes. So if you say that number of children are increasing in government schools because of financial issues, then at the same time, why do you see that the number of children enrolling for tuition classes is increasing? Just think about this. Just dropping out of school, private schools because of lack of money and financial resources. But why do we see that the number of children going for tuition classes is increasing? Because again, remember that these are reports, there's no definite answer, but we have to work out a way. Okay, so you see that one explanation can be because of COVID years, because of that gap in learning for the past 2-3 years, the families who can actually afford tuition classes are sending their children to tuition classes. So it can go to the fact that it is the affluent, it is the families with better means who are sending their children for tuition classes. Another idea can be if you compare your private school fee, this is say a private school, and if you compare the fee of a government school plus tuition classes, the private school fee still will be more. So people might think, why not enroll them in a government school? Because they have the same process, they are enrolled in the same CBSE board or the state board, and send them to tuition classes. Because the government quality of teachers and the quality of education is not better in government schools. But what to do if you cannot afford private schools? So you can go to that fact as well. Great. So you can think in these terms. So before say reaching say conclusion, let's see what the data says. Then also you see that over the years there has been improvement in terms of basic infrastructure like availability of drinking water, toilets, midday meal services, etc. So there has been a gradual betterment in infrastructure over the years in rural areas. And then also this can be linked to various government programs that have been going on for creating toilet facilities. So it is not just for households, but also for various other institutions. Then also rising awareness with respect to cleanliness and sanitation. Then also if you see that because of the push towards digital India, you find that there is a slight increase in number of computer labs. Now see, they have clearly mentioned that it is with respect to the availability of a computer in the school and students getting to use it. So they have mentioned it because then you find that there is a computer lab, and now if there is a computer lab in say government school, or not just government school but rural school in rural areas, with computer lab comes your air conditioner, because there's a lot of heat that is being generated out of the processor. And then you'll find in rural areas, I don't know about other areas, but in our area you find that it is your computer lab teacher, a couple of his friends, and particularly the PT teacher who have an arrangement to sleep in the computer lab. And the computer lab is rarely used apart from being used for playing solitaire, because I don't know what's wrong with Minesweeper that people go for. They go for these card games. That's their business. Okay, let's come back to it. So you see that still it is miserable. If you look at the number, it is still miserable. Then the availability. See, in schools, what we need books to study. We need library. We need to have teachers. We need to have basic infrastructure. And if you talk about books, computer, which is an essential part of our education now, because if you get educated without learning a computer, then you cannot ultimately be employed. So this is the state of infrastructure in our areas. Now, do you have to remember any number? No, but you do have to remember what are the basic services and what is the general trend. The general trend says that things are getting better with respect to infrastructure. But another thing is that we still find there is a huge gap when it comes to libraries and computers. So yes, you're talking about tuition classes as well, because you see that since one, it has become a trend over the years, but also another idea is that due to this COVID period, due to the learning loss that students face, and that reflects here, we'll come to this. This is the reason that parents are pushing students or children towards tuition classes. And also it can be due to the fact that there is a rising competition in terms of various examination, be it your school examination, be it your entrance examination to college, the complexity that you find in our curriculum. They are reasons for tuition classes. Because previously you'll find that the competition was not this much. The average scores in board examinations was not this high, that people are scoring 95 plus on average. So there was a difference. And also there were not many people who were interested in taking up education as a career. It was either government teachers, but now with digitization, with market economy, people are getting better opportunities in teaching. And there is a push from the supply side as well. Okay, so we'll come to the final aspects of Indian education. Let's look at some data with respect to the sector as such. Now, if you look at the learning outcomes being reading and arithmetic. Now, this at grade level basically is, so if there is a child who is in grade 3, they should have the basic level of grade 3. That is what at grade level means. So if they are supposed to know CAT, BAT, MAT, RAT, all those things till standard second, so they are expected to know at least that much. That is what grade level means. Now, you see that there has been a gradual improvement in terms of learning outcomes over the years, be it arithmetic, be it reading. But then you see that after the COVID years, since 2020, you'll find that these have taken a great dip. The learning outcomes have become poor. Grade level basically means if you are reading in standard 3rd, you should be able to answer the questions till standard 3rd. So you should know what was there in standard 2. So if you're taught subtraction in standard 2, you should be able to perform subtraction in standard 3. That is the basic assumption, because education, it goes on building on the previous concepts. So you learn arithmetic, then you apply it to higher levels. So the base remains the same, just the complexity increases. So the learning outcomes have taken a dip. Now it can be directly an impact of COVID, because students are not able to go to schools. And then if we talk about the falling learning outcomes, it can just think about it. So one idea can be people were not used to the digital means of education, neither the teachers nor the students. Then there was schools took a long time to actually put the system of digital learning in place. That can be a reason, because everyone was waiting. There was no clarity as to when the lockdown will get over, when will everything be back to normal. So schools also took their own sweet time to put everything in place. Now another idea can be that in the classroom, when students are sitting, they have a compulsion of, if not say not actually learning, but at least looking in the teacher's face and listening, because that's something they have to do. Because right now, for example, we're sitting here kilometers apart going through digital learning. I do not know whether you're scrolling on Instagram, lying on the sofa, you're eating something, or say most of you, or a few of you at least, are missing. So we don't know. There's no sense of compulsion. But at least in higher education, you see that the motivation comes internally. The students actually, because you are sitting here, why? You are interested in clearing this examination. You want to pursue this as a career, and you know that the classes that are going to happen will actually lead to that result, lead to that outcome. So you have a personal sense of motivation. But if you talk about children, they do not have that, and there's no sense of compulsion. Then you can think in terms of digital divide. Yes, the schools were able to provide proper education. Yes, they used the digital means well, but the children did not have say laptops and mobile phones at home. So it can also be in terms of digital divide. Now, yes, again, midday meal is another reason of children going to school. And with midday meal scheme not functioning during the COVID years, there was no incentive for at least a few of the parents to send the children to school or let the children study. Yes, so yes, I'm coming to that point, and in terms of learning outcome, so Deepika is saying, and she is observing, right, that these numbers are abysmally low even before the lockdown. That if 100 children are studying, and if you look at the outcome, only 20, 25, 30% of the students are actually learning something. And this has been the norm. Yes, they have taken a dip after COVID because owing to various factors, but yes, the numbers are very low, and this reflects on the level of education and the purpose of education, because it has more to do with purpose as well. Because we see that it is ultimately your intent. It is ultimately what do you actually want to do that counts. Because these say restrictions that we have, the problems that we face during our journey, so there can be socioeconomic reasons. For instance, you might not be able to get tuition. There are other children in the classroom who are actually performing better because they have better access to various things. Then you have to say get involved in child labor. So yes, there are impediments, but they would not matter so much if there is intent, if there is internal motivation. Yes, again we find that it is ultimately your socioeconomic say the socioeconomic background that matters, because that now your socioeconomic background has made you come to this classroom, the digital online classroom, because you have the say purchasing power, you have the awareness. And there are people who might have say better chances of clearing, but they do not have the access. So yes, it will reflect on your socioeconomic background, and that's why I was saying, if you remember from that discussion on class system, we were saying that yes, there is scope of mobility in class system, but you generally find that you do not have a lot of mobility. It is very less or not at all. Right. And now coming to the learning outcome, when I'm talking about the idea of intent, what I'm saying is, think about this. Since childhood, when it comes to education, what was the idea? Now, when you were in say class 5th, standard 8th, 5th, you were told that if you study well, study hard, one is that they incentivize you, that if you get first rank, will get you a cell phone, for instance. Then it was about if you get, yes, so it is basically based on rewards. Then if you clear the examination well, you'll be able to get the stream that you want in 11th standard. Then if you clear board exams and you clear the say examination, JEE examination or NEET examination, you'll be able to get into a better institution. If you get in a better institution, you will get a better source of income, or you'll have a better standard of living. So the idea is education, at least for most of us, has been a means to an end. The end being better standard of living, the end being getting into better institution, the end being getting a reward for getting good marks. And it has never been for the sake of learning. It has never been for the sake of learning. So learning has not been an idea. All we want is get good marks, because even we can ask ourselves, when sitting here in this classroom, most of us and majority of the students actually just want to clear the examination. They do not care about the conceptual clarity. All they want to know is, okay, how the question would come and how to answer it. They would not want to learn actually that how it can make you a better person, how it can help you implement policies better that will ultimately lead to, say, a better betterment of the society at large. And learning, gaining from this experience is not something that is there in our minds. And again, the push has always been towards rote learning, that you just remember things, you go on remembering things. We never focus on conceptual clarity. And even with respect to forget your say school education, forget your higher education, you think about right now, because now you have a better level of maturity compared to what you had previously. So you should be, say, able to understand things, right? And still we find that most of us would just want to clear the examination, get out of this process, and have a better sense of life. Most of us would have that idea, better standard of living, say class mobility, etc. The idea of power that is there in mind. And yes, this is the conditioning, this is the socialization that has happened right from the early childhood days. That learning has not been a part of our education, and that's why you find whenever you ask a question, because generally we go on saying that provide education, problem solved. Be it women, be it children, be it any aspect. Provide education, communism, solved. But you see that with the education system that we have, we find that you would not be able to find a lot of differences when you say speak to someone who's educated and speak to someone who's not. Yes, the one who's educated might have, say, a better level of sophistication in terms of language, might have better technical expertise. But if you talk about things, general things that actually matter in life, you'll find no difference at all. They'll end up having the same mindset. And then another idea with respect to education is very obvious. So this was a little on the psychological level that happens. But yes, another thing with respect to this is the quality of our study material, the quality of our teachers also is being reflected with these learning outcomes. That this is the quality of our say basically education. That most of the students who actually study do not learn anything, and this is one problem which your national education policy will try to address. Okay, so you don't have to remember this. You just have to remember the trend. You don't have to write from the examination. We'll come to the observation and we'll come to the kind of questions that can be asked as well. Yes, so while saying that midday meal scheme can be the reason for enrollment, but not for learning, because they'll go generally there for the sake of meal, because the poorer households, they're not able to provide them, say, midday meal. So yes, but if you remember, we are talking in terms of increasing enrollment in government schools. So yes, enrollment, midday meal scheme can be a reason for enrollment. Yes, so okay, you're talking in the right direction. That's what we were talking about. Okay, so our orientation more towards rote learning, our orientation more towards say serving a platter. So everyone wants everything on the plate rather than becoming a part of the learning experience. Everyone wants it served in the plate, fed directly into the mouth, and that is what is happening. And that's why you see that the quality is going down over the years. The quality of education is going down. Okay, let's see what have been the observations from this ACER report. Now you do not have to remember everything. These will become internalized. Once you read it once or twice during revision, then you'll remember that the simple idea is enrollment has been rising across all states and all age groups. For example, we see that moving towards higher education, secondary to higher education, the dropouts are more. The enrollment goes on getting less and less. But now there has been an increase in enrollments across all age groups. Then also you can think in terms of gender as well. Might be mentioned as well, but mention gender as well. The gender with respect to gender, with respect to girls and boys, now you do not find a lot of difference for that matter. Now, government schools, this is one observation that is an exception. So government schools have seen a sharp increase in children enrollment, and yes, we can think of what can be the reasons. Now, children's attendance remained relatively unchanged. There is not much change compared to previously, because that also you see that during the COVID years you did not get a report. Yes, there was a sample survey which happened, but otherwise, if you see, the attendance rates have remained unchanged because they are also supposed to increase. If the enrollments are increasing, the basic idea is the attendance will also improve. So that is not the case. It has remained pretty much the same. Now, there has been a slight increase in teacher attendance going to school, and there can be multiple factors for this as well. So one is more regulation from the government. You've seen that now attendance in the school is becoming compulsory as well. At least in your good government schools like your Kendriya Vidyalayas, it has been there, and they are the reason that we have at least a good number in most of the indicators. Because if you look at general government schools, the condition is very poor. Then attendance, there is a variation across states. Why you see this variation? Because there are states which are poorer compared to the other ones. Then there are states which were impacted more by COVID. So those states you'll find that children would have to go for say child labor. Children will fall sick more frequently because they're not being provided with proper nutrition. And this regional gap is going to be there. In every aspect, it is going to be there. And that is why there are few states, take example of Bihar, which are said to be underdeveloped or lacking in development compared to other states, because they generally lack on all the other indicators. Increase in proportion of children who attend tuition classes. Now, this is also something, because one idea was that the number of children in government schools is increasing because people do not have the power to pay. They do not have the purchasing power, and the tuition fees are pretty high in private schools. But then why tuition classes are increasing? We have looked into both the ideas. What can be the possible reasons? Now, they're not going to ask you what is the reason, and also it will be very hard to figure out the reason, because you do not know the socioeconomic status of the children who are taking up tuition classes, right? So all we can do is we can project that okay, this might have happened. The basic literacy levels have taken a big hit. Another exception, that already low levels of education, already low learning outcome, which has again taken a dip, and this can be because of the impact of COVID, because of the digital divide, because of people not having enough resources to send children to school, because of children having to take up labor rather than going to school, because of the impact of COVID. So there can be multiple reasons for this as well. Yes, so because of migration. So Saloni is suggesting because of migration as well. Now again, you remember that if I tell you something, that yes, migration has happened, but this survey is done. This is it is mentioned that it is a household survey. Household survey. Now they're not going to the school and doing the survey; they're going door to door, so that they get a better picture of the same. Because in school, again, it's not possible, and school you would have seen that there'll be a lot of students. There'll be some who might be able to answer. There might be some who might not. And also, when it comes to school, every school would want to show their school in a say positive light. They would want to show a better picture of the school. So there can be problems with respect to that. And again, it is a household survey, so that the spread is more. Now, there was gradual improvement in basic say learning outcomes, but it got interrupted in the pandemic years. Then Generally, we say that whenever it comes to girls and boys, whenever it comes to gender, we find inequality, and we might have a tendency of extending it to various dimensions. We might have a tendency of extending it to learning outcomes, say attendance, enrollment. But you find that there is not much difference when it comes to girls and boys in terms of enrolling in schools, in terms of attending the classes, and even in terms of learning outcomes. So they are. Uh, it's not that the girls are lagging behind; they're pretty much the same. And also basic facilities also show improvement. Now these are basic observations from this report. They'll be there with you. Remember the exceptions. Be aware that if there is something regarding the exception in the newspaper, do mention it. But just remember the general trend, and it will become normal. So one idea is that the learning outcomes have taken a dip. Then another thing is that the government schools have seen a sharp increase in enrollment, on which there is less probability of a question being asked. But if there is a question which is asked on, say, poverty or issues related to poverty and hunger, there you might use it as a fact. Then no difference in learning levels of children by the gender. So girls and boys have similar learning levels in school. So these are a few observations. Do remember the exceptions and the general trends, and do not have to sit and cram. Just go through it once, revise it once, and it'll be done. Yes, so teacher pupil ratio has increased a little, and also teacher attendance, and this has been covered ahead. Do not worry. Now the tuition is generally for science and maths. Yes, it is. Okay. Children addicted to social media. Okay. Okay. Yes. So layoff during COVID, people not getting work, etc. can be the reason. Okay. So okay. Yes, biometric has improved attendance. Yes, because of biometric, class teacher attendance has improved. So these were basic observations from your ACER report that is brought about by Pratham NGO. Now what we'll do is, after a short break, we will start looking into what are the problems, because these are observations. Let's see how do they convert into problems, and we'll look at the suggestions there itself. By that time, you just remember during revision, you have to just go through national education policy once, and the suggestions here have also been given directly from your national education policy, because this is the broader framework under which our education system is going to work. So let's take a break for now, and then we'll resume again. So let's meet again at break, after the break. Welcome back. Let's start our discussion. So what we'll do now is we'll look at various issues with respect to school education. What we'll do is we'll first take inputs from you, and then proceed with the issues that are mentioned, that either come from our ACER report or have been brought about by your national education policy. And also, you have to remember that the suggestions will come from national education policy. Yes, there can be other things as well which can be included, but primarily from national education policy. And someone is asking whether we should take it up from Google. You have pretty much everything mentioned in the slides. So even if you read the slides, that would be sufficient to understand about the national education policy. So one thing before we start with the issues, the difference now is that, and I hope everyone has gone through it. So previously it was 10 plus 2 system. Previously it was 10 plus 2 system. No, not everything just from NEP. Yes, there can be other suggestions as well. If you find the report in the news, or if you find some suggestions from by a committee in the news, you can add those. But primarily the framework has to be from the national education policy, because that is the direction in which we are going to move. Because if you're saying that the curriculum is not proper, there are issues with the curriculum, our national education policy is suggesting changes in that direction. So what better than the policy itself? But now with the national education policy, you find it has now become 5 plus 3 plus 3 plus 4. That means one idea is the elementary care. Previously, your preschool or your pre-nursery, Anganwadi was not in the focus. Now it has also been brought to focus. Then also you'll find there are there's a difference with respect to the way you choose subjects. There are differences in curriculum that you would have already heard about that. Now you can take up subjects from various streams. It need not be specifically say non-medical. Now it can be a mix of a subject from commerce and non-medical, for instance. So there are changes, and I think everyone is aware. But yes, as and when we talk about suggestions, we'll introduce these. Then if you talk about school education, now let's first classify into. Let's see how we can break it down so that it becomes easier for us to approach. So one can be issues related to school and infrastructure. Then it can be respect to the human resources, that is generally teachers and non-teaching staff as well. So you can include a couple of points from non-teaching staff as well, the administrative work, etc. Then what are the issues with respect to the curriculum, which will include books and availability of study material. Then the part of assessment, wherein see you have studied, you have read everything. How do you perform? How do you perform in the examination? That is the assessment part. And then there can be other issues related to students as well. Okay, so let's do one thing. Let's try to list a few issues that you suggest, and then we'll move on with whatever has been suggested by your ACER report. So in terms of infrastructure and school, what are the problems? What are the problems with respect to school and infrastructure? So one can be inavailability of basic infrastructure. We have already seen the status of basic infrastructure. So basic infra of the school can be a problem. Then yes, library, drinking water, etc. Then can it be related to access? Can we have a problem related to access? Absolutely. Yes, so sports, ground for sports is also a factor there. Then can there be an issue with affordability? The schools are expensive. And then with respect to access, you can say that in your hilly areas, there won't be, say, a good distribution across the regions. And you have seen documentaries where students have to walk for kilometers to reach the school. And it becomes a problem in the later ages. So initially, yes, parents in a company, maybe for some time. That is also a problem because you cannot leave a kid alone. Then in the later ages, with the household responsibility on girls and with the responsibility of taking care of agriculture with the family, because that's what the primary, means of economic activity is, primary economic activity is. With that, it becomes a problem. Yes, so they have to pass through forest, cross rivers. The way our parents used to tell us, right, that they had to cross rivers and go through forests, etc. But it is, at least in your remote areas, is a problem. Then it can be with respect to affordability, that you do not have government schools in your area. The private school that is there is very expensive. Also, you do not have quality education in government schools, but the private school is expensive. So these can be a few issues related to schools. Then what about issues related to teachers? What can be the issues related to teachers? Yes, rural-urban divide comes with access. Issues related to teachers. Absenteeism, or the issue related to attendance of the teachers. Quality of education that they provide. Teaching abilities, or methodologies rather. Okay, so if we talk in terms of quality, there can be an issue with assessment of teachers, because the way we recruit our teachers will decide the quality of teachers we are going to have. Then also with respect to teachers, that they would not want to serve in rural areas, that is going to be a problem because of the salaries and other perks that are there. Then the presence of unqualified teachers in private schools. Now, when I say private schools, it does not just mean your Delhi public school or your Bishop Cotton. It covers the local private schools that you have, and there the qualification can be a question mark. Then it can be with respect to teacher-student ratio. That you do not have adequate number of teachers with respect to the number of students. Lack of sensitivity of teachers, and you can think of it in terms of lack of responsibility as well. Then there can be various issues with respect to assessment both of teachers and students. Now, when we talk about assessment, our examinations are mostly focused towards remembering things. They're more focused towards what is the how strong is the memory part. They're not directed towards critical analysis, etc. Then the various state boards you have who have different syllabus, who have different ways of evaluations. That also is something. Then emphasis on rote learning can also come under curriculum. Then with curriculum, you see that there is a gap in the students that we have that our education system produces and what industry can employ. So the employability of our students, no focus towards extracurricular activities and your vocational training. Great. Okay, so this is something that you can understand, and with respect to students as well, let's talk about these one by one and try to come up with a solution then and there itself. So rather than going through the suggestions of NEP separately, let's go through this. And I hope you have the basic framework of NEP in mind. The way that they have talked about the fluidity with respect to streams, various streams, unification into one board, then focus towards elementary care, because if you do not build the base, how the building is going to be, how the rest of the building is going to sustain. So focusing more on elementary care and the preparatory stage. Then also introduction of vocational training, etc. So these have been various aspects of various provisions under NEP, and they have specific targets. So by which year, what is it that they want to achieve? Now you do not need to remember all the target years, etc. Yes, from prelims point of view, it can become important, but it has already been 3 years. Also, if there's something that comes up in the news with respect to your national education policy, that can become important. So you need not remember everything for that matter. Okay, so let's start with the issues here. Now, with respect to schools, we find that there's a lack of basic infrastructure as seen from ACER report. What can be done to take care of this? What can be done to take care of this? Now, for clean drinking water, toilets, etc., you have dedicated schemes. Then also you find that with involvement of private players, with a push towards privatization, we can solve this issue of lack of basic infrastructure. With increasing investment by the government, we can solve this issue. And your national education policy suggests that the expenditure that goes into education should be increased to at least 6% of the GDP, of the total budget. Then also this problem can be solved with diverting CSR from corporates towards education. So the corporate social responsibility, the part of it, it can be diverted towards education. So education and health can be considered priority sectors, and we can push the private players to invest in them more and more as a part of their CSR. Then also there can be a role of your civil society, that they can help in spreading awareness with respect to cleanliness, sanitation, etc. Then they can also help with the with the voluntary donations. They can also help government schools and even private schools to a great extent in betterment of their infrastructure. And you would have seen NGOs involved in planting trees in the school, cleaning the grounds. That they'll help at times to replace the benches or the desks the students have. Then you'll find their involvement in providing students with books. At times they'll help with setting up libraries in schools altogether. So there can be voluntary action. There can be voluntary involvement by various organizations and groups. Then in terms of accessibility, one idea is that there has to be an even spread with respect to schools. There should be more schools set up in every area. Then with respect to accessibility, private players also come into picture. That why one has to travel all the way to the city to get admission into a private school. Why not here in the village itself? So promoting private players here. Then you can think of affordability. And you, I believe you are able to think of the problems as well. The way we have discussed problems with respect to privatization in healthcare, you can apply the same logic here. So the pointers would not exactly be the same, but the logic remains the same. So to make it affordable, you have to provide free education. The right to education has to be implemented in an even better way. Then the private schools, their pricing structure has to be made transparent, and more regulation is required. They should not be led to charge too much fee. And then you can think in terms of, with respect to schools, you can think in terms of the levels of awareness that people have. That why we find that the attendance is less. Why do we find that children are not still being enrolled in schools? It has to do with awareness as well. So the way you spread awareness, that will also reflect on the quality of your schools, because then people will also be aware of their rights. People would say that why don't you make these basic amenities available in the school? Because now it is the ignorant attitude of both the administration, of both the school administration and the parents of the children, that we find that yes, there are resources at times, but they are not being used. So private schools will also, particularly in rural areas, will go on increasing their fees steadily over the years, but they would not improve the quality of services that they provide. So majority of poor population lives in rural areas, and private schools are more inclined towards urban areas. So yes, privatization can be a problem. So the same kind of logic that comes from healthcare. Now let's talk about curriculum. And these issues that are there more or less have been addressed by your national education policy, not in terms of implementation, but in terms of planning. So the policy design covers various aspects related to curriculum as well. Now, right now, just think about your experience of schooling. The one, as already discussed, it is more focused on rote learning. It is not, say, a very critical or the kind of education that one needs to actually grow, to learn things. It is always focused towards getting a viable employment. It is always focused towards clearing examinations. And also there you will find that even though it is focused towards acquiring a job tomorrow, but the employability of students coming out of our schooling and higher education system is very low. Why? Because there is no focus on skilling them. It is just mere theoretical understanding of things and not the application and the practical side of it. And also remember, it is not all negative, because the push towards theoretical understanding and keeping it theoretical, the better part of it is, the positive side of it is that it is the Indian scientists that you find everywhere who might not be say very skilled with respect to particular job, but they do have, because everything comes from theory. If the theory part is strong, that is when you can apply it. And ultimately you find that it is the people who are involved in research and development who are able to make good use of that theoretical understanding. Because if even they were made to say go for skills, learn some skills, they would not have been moving in that direction. So yes, skill orientation can work both ways. And then also you see that it is primarily on the basis of age that we distribute our children in various classes. That for to study in this class, it is not up to your mental ability, but up to your age, that yes, you can enter this class or not. Whereas you find examples of students, and particularly students of Indian origin, getting admitted into higher studies there in the US at a younger age. Why? Because then again, it depends on ability there as well. But here you would not find the same, because they on an honorary basis they're given admissions there. Then also you find that national education policy is not able to address this issue. The reason being, this push is still the idea is still age, because all your examinations that are going to come up in the future, they also have an age bar to them. Then the age at which you can get admitted into higher education also has an age bar. Then the age till which you can write this examination also has an age bar. So that is not being touched, that is not being changed. But rather what has been done is, so the previous no detention policy, which was changed in 2019, now it is not there. Now yes, you can fail, because there are positives and negatives of the no detention policy as well. You can think that student without learning anything has moved on to the next standard. And because of this learning gap, you can also find during the COVID, because students who came out of COVID, who actually cleared during COVID, they are not able to fare well in the higher classes. The reason being, there was a learning gap, they were promoted, but how do they, without a base, how do they build the structure? So if someone passed their 10th standard during the lockdown, you see them struggling in 11th and 12th standard. The reason being that there was a gap which was not filled, and they were merely passed or moved on to the next standard. Then the same logic here with no detention, that if you are not supposed to take up exam, if you are not supposed to fail, the exam does not matter, then the incentive to study goes away. And it is not just incentive to study, but the incentive to teach also is pushed aside. So one change now is that this no detention policy says till 8th standard you cannot fail a student. Till 8th standard you have to pass them in each and every standard. But it has changed. States are coming up with their own policies. the national education policy suggests that there be examinations in third, fifth, and eighth standard in which students have to perform. So rather than taking examinations every year, yes, there should be assessments every year, but there should be these main examinations in third, fifth, and eighth standard. Then we see that there are gaps with respect to our curriculum. That the way the curriculum changes over the years, the rise is very steep. The change is very say drastic. So from very basics, all of a sudden you move towards say higher concepts. And again, it is not ultimately on the ability that you're sitting in the classroom. You just clear the examination, and you might not be able to understand those complex things. The teacher teaching in the classroom is the same. He or she will teach in the same way to everyone, assuming that everyone has a basic standard. So, for example, here if we are studying, there is a basic assumption that you would know this much, and that's where we will start building up. But you find that there are students in every class who are at various levels. So that becomes a problem, and that has to do with our curriculum as well, because the curriculum is so designed that it becomes very complex too soon. So the spread has to be even for that matter. Now, unequal understanding and learning capability of children, they're sitting in the same class, but the abilities are different. So the approach has to be different as well. What can be done with, in this regard? Can you think of something? Because this is very practical. That everyone in the classroom, if everyone in the classroom is on the same level, this is generally what happened. That everyone in the classroom is on the same level. So what can be done with respect to this? Can anyone think of a possible solution? That what can we do regarding this? Yes, there can be a provision of extra classes to the ones who are lagging behind. Someone is suggesting a screening test, but you think of the examination that happens in the previous year is basically a screening test for the coming year. So someone is suggesting that the social stigma attached to the failure in exams actually increases mental stress. Yes, so that is the negative side of it. Need more focus on weak student, but how do you do that in a classroom? But how do you do that in a classroom? Now the issue here is not with the teacher, but issue here is that the learning levels of student in the classroom are different. That is the problem. Starting from basic to everyone, don't you think it will be unjust to the ones who are already there? So yes, so one idea can be consistent evaluation and consistent monitoring of the performance of the children and making changes accordingly. So if you, because generally what happens to extra classes? The extra classes are towards the end of the year if you do not have proper attendance, if you have say lack of attendance, or you have failed in the previous examination. And generally this extra class also happens only in the board years. So why not evaluate the performance, monitor the performance of each and every student on a monthly basis, because that is being done with your unit test and your sectional test. That is being done. And why not highlight that okay, these are the students who need extra attention and make a provision for extra classes. And now this sounds very logical, this sounds very simple, that yes, this can be done. But the thing here is, the impediment here is that the willingness of the administration and the teachers. Because if it has to be done with no remuneration, with no money involved, the teacher would not want to do it, and the administration would not want to incur extra cost on the same set of students. Because ultimately 100% at say result can be achieved. That is not a big issue, because you do have certain questions which can be targeted and everyone will clear. So yes, these can be considered as remedial classes. Okay, so someone has mentioned that giving incentive or scholarship to children if they perform well. Now we have to, okay, so Deepika had suggested the right thing, and we have to think about this, incentivizing for studying better. Now, is it the right way to do it or not? Because this is the idea that we had proposed, that since our early childhood, it is because of some or the other reward or incentive that we are made to study. So is it in the right direction or not? Would it actually say reflect on the learning outcomes? Yes, so government has already applied, and it has to more to do with the implementation. So let's see, because things take time, and this thing should also get better. Okay, so see, if you do it for incentives, what if you say that okay, we'll say give you a chocolate if you clear this examination. Take for example. Now yes, they might perform well for the sake of getting a chocolate. If it's a say second, third, fourth standard child, they might perform well. But what happens when that incentive is kept aside? When the incentive is taken back? If tomorrow you say that today yes, for the incentive they'll work, they'll study. But what if you remove that incentive tomorrow? Will they still study or not? And generally we find, because there is no perfect solution to this, but generally we find that it is because of the incentive. Just think of it. If not to clear the examination, and the perks attached with the examination, because the way we have a lot of people lining up for the civil services in India, you do not find the same way in Britain, and they are the ones who actually put this structure in place. You do not find that kind of queue in Britain, but you do find in India. Why? Because there's not a lot of say discretion and perks attached to the work. The moment you remove the perks, the moment you remove the incentives, people will drop out, and you will think in terms of our system as well, not just civil services, otherwise as well. People, why do not see? One is people do not have a lot of chances to pursue their passion as their profession, but most people will drop out if there is no incentive with respect to this. Right, so yes, we will come to other points. So just think about it. So incentivizing for something. So incentivizing private players to build schools is fine, but say giving out monetary incentives or rewards to children to study is slightly problematic. Okay. Yes, so appreciation can be a way. Yes. Okay, so what we have to do is, what problem we were addressing was that if there are students sitting in a classroom, they are at different levels, but the teacher who's teaching has to maintain a certain level, because if you oversimplify, then ultimately that is also harmful for the students. So you have to maintain the basic standard of the grade that they are studying in. How can you do it? Monitor the performance, and these things are mentioned in the PPTs. You do not need to worry about writing this or remembering these. So this can be addressed. Now, with respect to curriculum, one thing we see is that there is compartmentalization after 10th standard, that you choose one stream and then you have to move for your entire career in that stream itself. Say you choose commerce, now there's no way after 12th standard you can move back to science, and vice versa. But yes, there are humanities subjects wherein anyone can actually take admission, but you cannot do the same with your technical education and even your education related to commerce. Now, what has been done is, because what happens is, if after 2 years the student realizes that, okay, I'm not able to cope up with these studies, and this happens very often, and students tend to drop out from the school and the college as well. So there should be an option to experience multiple subjects at the same time, which has been provided by your national education policy, that you can take up subjects from various streams. There is a fluidity. You can choose multiple subjects together from different streams. So one is that. Another thing is, even because that is extended to higher education, so even during higher education, if you feel that, no, I'm not able to work this thing out, it's better I look for a job or maybe look for another course, then the years that you have invested right now are lost. Because if you drop out in second year out of a 4-year degree program, then you are still considered 10 plus 2. What about the 2 years that you had invested there? So the new education policy in terms of higher education talks about giving various, say, options to exit. Over the years in your graduate studies, you have options to exit. So you can get a certificate, diploma basis when you leave the education system or when you drop the degree. So that is extended, but you understand that this fluidity in curriculum goes well with giving multiple options to drop out. Now let's look at the issue involved in that. Now, yes, students will have a better choice. Students will have a multidisciplinary approach, because when you come to UPSC, you find that it is actually everything that you need to know, rather than studying in silos, rather than studying something specific. It is everything that you have to know together to say fare better in life. If you have only the technical skills and do not say understand society, then the purpose is defeated. Then you will not be able to say contribute to the common good. Now, what is the problem? What is the problem with this multidisciplinary approach? And rather, fluidity in choosing subjects, flexibility in choosing subjects. Can you think of any possible drawback? Because this is something you have to think. This is something you would not generally find in your analysis. Yes, so one idea is the student might remain confused over the years as to which direction they want to move in. Then also, taking up scientific subjects with your say humanities subjects might become difficult to learn. Then also, specialization takes ahead, and that's where I wanted to point out that yes, one idea is specialization takes ahead, and because today with specialized studies, today with education in one domain, we are barely able to provide jobs. We are barely able to make our students employable. What happens when they do not even have that expertise? Because with growing science and technology, we find that you need more and more specialized work rather than general work. So what happens in that case? Great. So this is one drawback of having to choose multiple subjects from various streams. Then you talk about the language of instruction. They generally, particularly our technical education, science and maths at least, they are there. The instructions are in English, and not just that. Even the study material that is available, you find it in English and Hindi. And Hindi is also widely available, but that is it. You do not find your standard textbooks in different regional languages. And it is the regional language. If a student is given instruction in the regional language or in their mother tongue, that is the best way to communicate, because that is where they actually relate easily compared to a foreign language. Because foreign language can be English, or maybe foreign language can be Hindi. Hindi can be foreign to someone who speaks a different language at home. So providing education in the mother tongue, one idea. Second is availability of study material in each and every language. At least your standard books that have to be used, that are generally provided by NCERT. And again, NCERT has also been tasked to take up this curriculum redesigning and reorientation. So the standard books at least have to be available in different languages. Yeah. And then also what happens is, because of this language thing, because of the language issue, we find that all our technical higher education is in English. Technical higher education is in English. Now consider a student, because at least till 12th, they can take up say Hindi or regional language. Now till 12th standard, they study in their regional language or say Hindi. And then for technical education, if they want to go for technical education, they have to study compulsorily in English. And then there is this language barrier. The teacher is not able to communicate to the student in a better way. So why not promote even technical education in regional languages as well? At least a few Indian languages should be there. Then the idea of multilingualism also comes in. That rather than making them say compulsorily study 2 languages, why not introduce multiple languages? But they should be optional. It should be a matter of choice. So rather than forcing one language, it should be a matter of choice, that what the student finds suitable. So for that also you have a provision. And then also with respect to your instructions in regional language, it is mandated till 5th standard that the instruction should be provided in the regional language, and preferably till 8th standard. Again, need not remember, it is there in the PPT. Then with respect to curriculum, are there any other issues that you can highlight? Apart from these, are there any other issues with respect to curriculum that you can highlight? Yes, so students might end up taking easier subjects, choose easy subjects for the sake of performing better in that say boards examination, and they might find an issue with respect to employment later. So students-teacher relationship we're talking about. Yes, students do not ask questions, hesitate to ask questions. That can be covered with teacher. We're talking about the issues with respect to curriculum. So yes, the curriculum, one language we have already discussed. Then another idea is the curriculum is more theoretical than practical. So it is less and less practical. It focuses on rote learning. Then also with respect to the curriculum, it is not related to skilling at all. So where you are writing that there is a skill gap in terms of education that we provide and what the demands of the industry are. So there is a skill gap. That means vocational education can come up as a solution as being discussed by your national education policy. So they say during your secondary education, that is 9th standard onwards, should be given option and should be provided vocational education to bridge that skill gap. Then also it has to become more practical and applied, because we do not know how to file our taxes, but we do know various curves, right? So it has to become practical as well, so that it can be applied to day-to-day say cases as well. Then the push from rote learning, the push from remembering things, the push from memory has to be switched to analytical and conceptual framework. And this is something which the NCERT has to work out. Then also you're suggesting that we do not have ethics classes, but see, we do have moral education as part of the curriculum. But yes, it is about moral stories, etc. That actually does not lead to the kind of thinking that we need in students. So yes, vocational education. Then you can also think of extracurricular activities. These have also been mentioned by your national education policy, that there has to be a push towards extracurricular activities as well. Because over the years, for the at least past one decade, you find students being pushed more and more towards only studying because of the rising competition, because of population growth. There is a struggle for getting employed. So the better marks you get, the better employment you might get. So because of that, pushing away all the extracurricular activities. And do you remember at all during your 11th and 12th standard whether you were involved in any extracurricular activities at all, or whether the school provided the same? And you would say no. It was mostly studies that we were limited to. So yes, rather than spoon feeding, it has to be conceptual. It has to be it has to be more analytical for that matter. Students should actively participate in the discussions in the classroom. Then this one size fits all approach can be thought of in terms of your changes that CBSE is introducing. That is the next thing that we are coming to. Now there'll be a single board which will kind of make it uniform, which will make the curriculum uniform. Because now there are a lot of differences, a lot of gaps with respect to what state boards provide, what various state boards provide, and what the central board does. Now there'll be uniformity. But can someone mention the lopside or the say negative aspect of making it uniform, making the curriculum uniform? Because the positive thing is that everything will be on the same line, because everything can be calibrated to the skill sets that are required for the industry. Yes, so there it will impact the regional history. Yes, regional. You can think in terms of culture. You can think in terms of you'll find various state boards giving focus or focusing on various regional aspects like the history of it, various cultural traditions. That will get lost because if you make it uniform, then you will not focus on that. But here, the national education policy talks about giving autonomy to the state boards, making one body, but giving autonomy to change curriculum, to make changes to the curriculum. Okay. Yes, so uniform curriculum can also restrict teachers' flexibility because there as well they are because it is again theoretical. Now let's see what happens on the ground. It will take another 5, 10, 15 years to analyze the same. They are definitely talking about giving autonomy to the teachers as well to decide how do they want to proceed. But at the same time, you'll find that it is generally the framework that is provided to them is what they pay attention to. Because if they tend to change, then not just the administration, but the students and their parents will also protest, will also resist the change. So if there's a teacher who would want to do better, who would want to make actual changes and proceed in their own style, they are generally rejected. So that is another problem. So this can be thought of in terms of curriculum, and the suggestions are there in the slides to come. Then let's come to the issues related to teachers. Now, teacher, one idea is that we do not have educate ratio, so we have to recruit more number of teachers. Because you find vacancies in government schools that are there, the perpetual vacancies, but they are not being filled. Then also, what private schools do is they create sections till J, K, L, M, and O. They'll have more than 10, 15 sections, but they would not recruit more teachers on that basis. So they'll have more number of children sitting in one classroom. They'll have more number of sections. The teachers will be overburdened, and they will not be able to provide quality. One aspect is that. Another thing is the student-teacher ratio. The teacher-pupil ratio will also get changed. So one is this: you have to say push towards filling those vacancies and push private schools as well to maintain a standard pupil-student ratio. The way we were talking about, say, a desirable doctor to population ratio. Here also there should be a standard that okay, you cannot have students more than this. The ratio should not go below this. There has to be a standard which needs to be maintained. Then let's start from recruitment of the teachers. Now the one thing is that the recruitment process is not very say good for that matter, because you find that most of your recruitment happens on the basis of objective examinations. You can think of even your assistant professors, the net examination that people go through. It is generally objective. It is objective. Yes, there is say certain amount of subjectivity involved during the interview, but it is primarily objective. And how can you determine the level of analytical skills or analytical mindset of the teacher on the basis of an objective paper? So right from the recruitment, and even for your school teachers, you see, because here we are talking about school teachers, you see the tests that you have, various CTET tests and national level eligibility tests. You've seen the standard of those. Then again, once they're recruited, where is the training? What is the kind of training that you provide? Then with respect to the eligibility criteria to be a teacher, there is this bachelor's in education that is mandatory, that you must have. But that, more often than not, it is just a degree, it is just a paper, because the teachers who are taking up that degree, they do not even go to the college, they do not take classes, they just give the examination and that's all. And also the content of that teaching. So with this respect, you can think right from the beginning, before a teacher is recruited, whether they fulfill the eligibility criteria, because in private schools, you'll find that a lot of teachers do not even fulfill the eligibility criteria. So there has to be uniformity with respect to eligibility criteria for government schools and private schools. You have to maintain that uniformity. You cannot even be a private teacher if you do not clear this test. There should be that. Then you come to the content of the eligibility. That is your bachelor's in education. It has to be changed. It is right now 2 years, and the national education policy is talking about is changing it to 4 years. It will be a 4-year dedicated program. And not just that, you have to maintain the standards. So they are talking about changing the content of it as well, so that we can train our teachers better. So one is this. Second, you can change the way you assess your teachers. The exam that they clear, there has to be changed there at that level as well. Then you come to the training part. There has to be dedicated training before the employment, before starting teaching, and also during teaching. So once the teacher starts teaching, every year there has to be a little upskilling. There has to be, say, professional development for that matter. And that's why you find that traditionally your teachers would not want to invest a lot in upskilling, would not want to invest a lot in learning. And in this regard, you have, yes, on-job training that you say. So in this regard, you have national education policy talking about professional development courses. So they'll have a mandatory, say, 50-hour course every year for professional development. Then also you think about not just these courses, but also upskilling, or also say improving on the content over the years. So because once a teacher gets recruited, particularly in the public system, you find that they lose all zeal. In general, they do not say go on improving the content. They do not learn new things. They would not want to include more things to their skill set. They just get laid back. Now I have this job. Now I have a secure income. I just have to come, because if you're teaching a 10th standard kid, you do not have to work on yourself a lot. You can go on repeating the same thing. You can go on repeating the same method. So neither do they experiment for their own self, nor do they do it for the children. So why can't there be, with the professional development, why can't there be the tests for teachers as well? Why can't there be, say, annual assessment for teachers as well? Because right now the assessment of teacher is basically how the children are performing. So why not a test or annual assessment for the teacher? yes, stagnation of knowledge for that matter. So, but there's no provision for say regular assessment, and that is something that can come as a suggestion. Now, teachers not giving special attention in class, yeah, because no matter what the strength of the class is, unless until it is one-on-one interaction, there cannot be spatial focus the way the student is desiring. Yes, there can be spatial focus in terms of toning down the content at times and maybe taking it a notch up so that you cater to both the categories of the students, but there cannot be say personal attention as such, and that is not desirable as well. Then where is the learning part? The learning part gets lost, and you see that there are schools. I'll give you an example of schools. There are schools. They are again CBSE schools, Valley schools, and if someone is from either Andhra Pradesh or Karnataka, they would know that there are Valley schools started by Krishnamurti Foundation, and you'll find that the way of teaching is different. There is no teacher as such, so it is basically they will mentor the students. There is a classroom. Students have to do it on their own, and there'll be mentors, rather teachers, who will help them out with the same. So rather than teacher telling what to do, how to do, they just teach them how they can go about it, and it is ultimately the students are doing it, and they do it right from standard 2, 3. They right from the early ages. Just think of the level of understanding of those students. And yes, again, another idea is the level of understanding does not necessarily translate into a better career, does not necessarily translate into what market feels that this is right. Because generally, your profession or your success comes down to what market thinks is right. What is it that the market needs? But as an individual, as the say development of their personality, just think of this process that they are being made to do it themselves and just given direction right from the beginning. So Sneha has highlighted that how testing their knowledge take care of the way of their teaching. Now again, we are not testing just their knowledge. These are again with respect to their professional development as well. So rather than just taking professional development credits, let's see what has been the outcome of the same. And there's no problem as such with respect, because teaching style is very subjective. Because even in the same classroom, few might feel that this is good, few might feel it is not. And then again, say the utility, or say if someone is happy with it or not, does not necessarily mean it is good. So yes, there is subjectivity with respect to that. But why not, if you are providing them say professional training, why not assess them on that basis? Okay, so the idea I was giving is with respect to Valley School was that they have a different style of teaching, and why not? Why should these schools not experiment different ways? And let's see what works out the best for them. Okay, coming back now, the poor quality of content of teacher education. In this regard, you'll find a provision for bachelor's in education that is mentioned ahead, and you can just go through it. That the number of years have been changed, the curriculum is being redesigned. Then one you had highlighted is deployment of teachers for non-educational purposes. This is limited to your government teachers and at times private teachers as well. So, for example, for census duty, for election duty, you'll go on sending your teachers because of lack of say administrative staff. Now, this becomes a problem with respect to learning outcomes in children, because now they are doing some other duty rather than involved in teaching. They're doing non-teaching work, and also in private schools, maintenance of registers, taking help of teachers in administrative work, and rather forcing teachers to take up administrative work. This also becomes a problem with respect to them fulfilling their duties for which they have been hired. Now, teacher vacancy is not being fulfilled. So, for this, you can think of various news articles. You'll find that the vacancies have not been filled. Because, for example, recently in Haryana, then in Rajasthan, you'll find that this is always there. Then, with respect to your government schools, you'll find excessive transfers. Particularly, you think of Kendriya Vidyalayas. The teachers will go on getting transferred over the over the country in various places. That also works on the mindset of the teacher, because they know ultimately they'll be moved. They would have to move from here. So rather than thinking of taking up teaching as passion, they think of just an activity, just an economic activity, because they know the children that they might get attached to in the process of teaching, they would have to lose them sooner or later, because they will be transferred elsewhere. And also it reflects, it has a negative impact on children as well, because they get connected to a teacher and they start understanding, because it is a process. They might not be able to in the first 2 months, and slowly and steadily they start feeling connected to the teacher, and they start enjoying the process as well, and the teacher is transferred. So one is responsibility of the teacher that becomes a problem, and also it impacts the children directly as well. Then again, if in this regard, if you see, private teachers are better off in this regard, because they would not be transferred, they stay in the same place, so they have better opportunity to work on the same set of students for 4, 5, 10 years and see them succeed. But for that, they'll need to have the sense of responsibility. Then again, the new recruitments that happen are generally on contractual basis. For example, not just in government schools, you have seen that a lot of contractual teachers are being hired. They would not have the sense of responsibility. Just think in terms of the substitute teacher who used to come when there was, when the actual teacher was not available. So they'll send a substitute teacher. And you remember, it was all fun in the classroom. It was all asking your names, where do you come from? And the entire hour will be lost. So even contractual teachers to that extent would not have the sense of responsibility, because even parents would not be able to hold them accountable, because the next time they come, they might not be there. So for this matter, and why do governments do that and private players as well? To save on the cost, because if you have a full-time teacher, then you would have to give them a hike every year. But if you have a contractual teacher, you let them teach for a year. Once they ask for a hike, replace them with another set of contractual teachers to save on the cost. And this is generally this is the reason generally it is done. Now also, you can think in terms of to make the issues with respect to teachers better, to hold the teachers accountable. Now we do have parent-teacher meetings, but let's increase the frequency of parent-teacher meetings. And rather than them just be a report card of the student, let it be a report card of the teacher as well. Whether they have been making changes, because the children are not able to learn, if they're learning outcome the poor, the teacher is a part of the problem as well. So there might be something with respect to the teaching style, because it is not generally it is considered that it is the student's fault that they are not able to learn, but it can be a problem related to the teacher as well. Then apart from this, with respect to teachers, we have seen what can be done. Can there be other suggestions? Can there be other suggestions apart from improving on the eligibility part, wherein you are talking about bachelors, making it for 4 years, changing the curriculum? Then the process of getting selected as a teacher, the process of going through the examination, there can be changes definitely there. Then during and before the job training, so on-job training and training before the job. Then professional development. Every year there can be courses, they can be credited for the same, and the teachers can be assessed for that matter. Then apart from this, do you think of any other changes that you can suggest with respect to making it better for the teacher? Because whatever is there in the policy has been discussed pretty much. Incentives for improved learning outcomes, yes, you can suggest, but again, you always remember that you mentioned both the sides of it. Professional development, time to time training is done professional in terms of professional development as suggested by your national education policy. What else can be there? So we can resist these excessive transfers, not let them deployed in say anything apart from teaching work, fulfilling vacancies in time. Yes. Now just think of your elderly. Just think of your elderly and you get 2 pointers, one to add here and one to add there. Can you? Yes. So the ones who have been retired, let's learn from their experience. Let them make mentors. Let them be the mentors for the teachers. Let them provide feedback for the teachers. Let them share their experience of making children learn because they have done that for say 30, 40 years of their life. Learn from their experience. So one is they become mentors, help us, help the teachers. And then the other idea is the elderly who do not have work, who have financial insecurity, can also be taken care of. So this is a pointer that you can mention there as well in terms of the issues related to elderly. Yes. Then also let's do one thing. Let's quickly go through whatever is there on the national education policy after we finish this aspect as well. And apart from this, one aspect left is the assessment of children. The various tests, etc. that you have. The problem is rote learning. The problem is focus on remembering and memory rather than concepts, so which has to be changed. Now then, we say that there are various agencies that they are conducting separate tests. So there can be one agency which takes up all the say, assessment part, and these things have been suggested that will look there. But do remember that assessment also has to be considered. You can take it separately. You can take it with the other issues like issues related to students, because issues related to student also think in terms of your attendance, enrollment. Enrollment has been pretty much taken care of. Then attendance, dropout. These are also the issues that are there. Now you see that there are issues with respect to children that also factor in, and there are provisions for them as well. So not provisions, but at least objectives. So one objective is achieving 100% enrollment by 2025, which I was saying that sounds ambitious, but we see that not more than 2% of our children now are not enrolled. So yes, it is pretty much practical and achievable. Yes, for affordability, I think it has already been discussed previously, right? Then you talk about attendance, that as the standard goes up, number of students, the attendance rates go down. Also, as the standards go up, as the level of education goes up, the dropouts increase. The reasons being, it can be related to poor learning outcomes, that the children are not able to learn. They are frustrated, and you will find that at times that I'm not able to learn. It's the kind of education that I'm getting is not helping me with anything. I'm not able to perform in the examination, not actually learning anything, and they drop out. That can be one. The another thing is, if it is a boy child, you'll find that in poorer households, they will send them for labor. They would have to get involved in labor, because of which they would not be able to attend school regularly, and then ultimately drop out before they get into higher education. Then the cost of higher education also factors in, because the cost is so high that they cannot possibly afford the same. So they keep going to school till 10th, 12th standard, and then pick up a job. And generally you'll find if you're coming from the service sector, generally you'll find the office boys that you have, any kind of office clerical staff, which is very low paying desk job, you'll find them involved in those. They are the ones who are not able to, because of the cost of education or other factor, they have to take up work. And then with respect to this, I'll just tell you a little story that was there that I've gone through recently. So there were 2 office boys in Mahindra office in Bombay, and as a experimental program in collaboration with a university, they were provided management course. So they were whatever salary they were getting was given to them as stipend, and they were provided that good quality B school education for 2 years. They were given that MBA option, and now in that MBA they were provided with mentors who were amongst the students. So there are students who have taken admission. Now they have to mentor these people as well, the ones who are coming indirectly, who are not coming through a process, on an experimental basis. And the outcome was that they fared better than a couple of their mentors as well. And this has been an experiment which was done years ago. And now you see that if one has that zeal to learn, and if provided with the right circumstances, they will you understand this, that ultimately something better will happen. Because now, yes, they had to be taken care of for some time. They had to be provided with stipend because they have to take care of their household. They have their household responsibility. But just think of it: if not for that household responsibility, if not for the say high fee for higher institutions, they would not have struggled for all those years. So why can't we have better programs? And this is something we will discuss with the higher education. And let's get back here. Let's not move into that. Then another idea is, if it is a girl child, more often than not, you'll find them becoming a helping hand with their mother in household activities, in household work. That becomes the reason for lack of attendance and dropouts at an early stage. Then it can be your child marriage, because of which students leave school. Then also you'll find your socio-economic status also matters. That if you're coming from a poorer household, the chances are you're not getting proper nutrition. The chances are your healthcare needs are not being taken care of. And the chances are, because of these issues, you will fall sick frequently. And if you fall sick frequently, ultimately your attendance levels will be low. Then the idea of gender equality, as already discussed, the girls contributing, and this gender inequality is both ways. Gender equality in terms of child labor, it is generally the boy child. Where it is household work, it is generally the girl child. So it is not just inequality or discrimination with respect to girls, it is discrimination with respect to boy as well. The way we say we have pink collar jobs, the similar argument holds of why do we find only men in blue collar jobs? Why do we have a majority of the plumbers are male, for that matter? So there can be counter arguments for pretty much anything. But here you see that generally, because this is coming from NSSO data, that generally it is child labor, because of which students tend to drop out, and the learning outcomes as well, that they are not able to cope up with the level of education. So these become the major reasons for students dropping out and the low attendance rates. So with this, you can see that pretty much we have discussed all the issues with in relation to your school education, and also we have looked at a few suggestions from your national education policy. Now what we can do is, you have to go through these, because the idea is that in this framework you have to fit in your suggestions, that what government wants to do, and whatever is left. Because there was a question from someone that what about other? Why only NEP? But whatever is left is coming as a suggestion, is coming as a way forward, is coming as a evaluation of the policy, right? So broader framework, this, whatever suggestions you can, because you'll find suggestions everywhere in the newspaper. You can find something or the other coming up every day. Now these are basically provisions of national education policy, but they can directly be these suggestions. For instance, 100% gross enrollment ratio by 2030. So a target which deals with, say, because of this you would have to take care of, say, accessibility, you have to take care of affordability, you would have to take care of other issues like child labor, etc. So in the same direction. Similarly, you'll find the one thing that we haven't discussed is early childhood care and education, because this is something new. Previously, it was not given any importance. Students are going to Anganwadi, getting their midday meal, and that's it. If students are going to preschool, it was not say given due importance. But now, with the new policy, this is also coming into the focus. Now, from 3 to 6 years, government has to ensure quality childhood care and education for all children. So education for all now starts from 3 years old. Previously, it was starting from 6 years old. Now it starts from 3 years old. So increasing the spread of education. Then here you'll find that they have to go to say Anganwadis and preschools from 3 to 5 years. Then in the 6th year, or at the age of 6, before the age of 6, they have to be say, taken to the general schooling system that we have, because even in preschools and Anganwadis, you'll find that they have limited the number of hours, that you cannot keep them beyond that. Then there has to be say various activities which actually lead to betterment in cognitive ability of the children, because this is the age where they learn the most. This is the age where they pick up languages easily. And then you see that they have to be slowly transition into the regular schooling system, but that too in a way of play-based curriculum. And now the responsibility of the entire curriculum is going to NCERT, that you have to see. And then there has to be say change in curriculum and basic framework provided by and developed by NCERT. So this is one. And also this can be an argument, counter argument for language policy as well, because it is generally at the earlier ages that you can actually easily pick up languages. And the more you age, the complexity with respect to changing your existing patterns of the language understanding becomes difficult. So multilingualism, if at all needs a push at an earlier age. So we cannot just restrict till 5th standard, restrict to mother tongue till 5th standard. There has to be an introduction of other languages as well, and it is provided. It has been provided with respect to our national education policy. Then equitable and inclusive education, because affordability is an issue, accessibility is an issue. Why not focus on them? So why not focus on the gender which is lagging behind? Create a gender fund for them. Then also the ones who have been left behind, the ones from say your differently abled sections, ones from socioeconomically backward sections. Why not emphasize specially on them? Now the way in which they are going to do it is yet to be finalized. A few ideas can be providing them with scholarships, providing them with say free books, etc. There can be a few suggestions for that matter, and a few of them are already in existence. But let's see what the exact framework comes up to be. Now also you see that the changes in curriculum, as already discussed, that the quality of our textbook material has to be increased, which is to be developed by NCERT and SCRTs. SCRTs are your state level councils who work on these. And similarly, you remember here one thing here, that when we talk about NCERTs now, the NCERTs are actually of good quality, but the way they are taught, the way they are say received by the students is the problem. Because you take up your NCERT for 9th, 10th standard, take up any NCERT, you'll find questions in the box. If you actually want to learn, you just try to answer those questions. Particularly, you look at questions in your political science textbooks. You look at those questions. Those are the kind of questions which will actually need an in-depth understanding of the concepts. Those are not the direct questions that we find, because at say lower sections we find that it is direct questions from the book that are given at the end as an exercise. But these are the kind of questions which will actually make you storm your brain. Also, your NCERTs talk about various activities, and I hope, if not back then, but at least today you're going through NCERTs for this preparation, and you find there are a lot of activities that are say mentioned there, that the teacher should engage students in that activity, this activity. But did that at all happen during your schooling years? No. So it is not just with respect to your quality of the textbook, the way the curriculum goes, the way it is done. Because till now, till today, we find that even students want the same pattern. Even students want the teacher to take down notes, replicate them in the examination, and done, good to go. No one wants to learn. No one wants to storm their brain, because maybe it's because that the student feel that I have already submitted the fee. Now it is your duty to take care of it. And then you see that most of you, when you are talking about the attitude of teachers, and you see that the relationship between the teacher and the student has changed over the years. So traditionally, you see that you used to respect your teachers, etc. Now it is a basic service provider relationship. That teacher is providing services, the student is the customer, and that's it. So it is all about value for the money that you have paid. So rather than for the sake of learning, it has changed. And the counter argument is, previously even teachers were not doing it just for the sake of money, right? So your Gurukul system, traditional Indian system of Gurukul, etc. There's no monetary aspect involved there, right? So yes, the attitudes have changed, on both the sides, which need to be. Yes. So when we say let's go back to our tradition, let's preserve our tradition, it is not the various aspects that are being taken up these days. It is the better things that are there in our tradition, in our Indian tradition. So maybe yes, a little push towards our tradition would go a long way. So states, and we were talking about autonomy to be provided. Yes, the overall framework has been decided that this is the framework. These are the limits within which your syllabus should fit, the curriculum should fit. States will get autonomy to prepare their own textbooks and curriculum. This is also provided under NEP. The availability of textbooks in all regional languages. Why? Because most of our books are available generally in English. So push towards regional language as well. So reducing the weight of school bags, ensuring suitable changes, because we're saying that it becomes very complex and factual at the same time. So change it. So these changes which have already been discussed. Now multilingualism, the medium of instruction. One idea is medium of instruction being mother tongue till 5th standard, preferably till 8th standard. And the other idea is introduce various Indian and foreign languages, and also standardize the Indian sign language across the country, because there are variations with respect to Indian sign language as well. So why not standardize it? Yeah, so yes, sometimes these school bags used to weigh more than the kids carrying it. And if you remember, there was a commission which actually practically weighed the school bags, and found out that yes, at times the school bags were weighing more than the children. They are actually observations from a committee. Then reforms with respect to assessment, the way your students are assessed. So tests have to be designed in a way that they focus on analysis, critical thinking, and conceptual clarity rather than your memory. So generally, we find that the tests are based on memory. Even if you look at your IT examination, now it is, yes, you need logic, you need logic to solve those questions, which has to come. But now the thing is the timeline that you get. You have a very limited time to solve those questions. So the general idea is just you remember the logic, you remember the steps that have to be done, you remember the formulas, you remember the shortcuts. So this also, something as logical as mathematics, also becomes factual when it meets our education system. Then boards need to be reformed. Why? Because the level is not much high, but the competition that is there, the curriculum that is there, because you have a lot of syllabus for board examination, because of which students have to move towards tuition classes. So to eliminate the need for tuition classes, reform in the board examination, and also now you will have an option to go for board examination again. That if you have given one examination once and you feel that okay, I'm not comfortable with my score, I do not feel the score is right, you can write it again. So there is that option as well. Then also there'll be school examinations in standard 3rd, 5th, and 8th because the no detention policy has been done away with, and now there'll be examination in these 3 grades. So yes, one main examination, one main board examination, one for improvement. Boards will be made easier. Easier in the sense, right now they're more factual. They have a lot of information that you need. They have to be made more and more conceptual. So yes, in this regard, your Parak, you can just go through it, that they will standardize the test and the assessment levels. That they will tell how it has to be. Yes, states will have autonomy, but the overall framework will be decided by them. Then you have various aspects related to vocational education, achieving foundational literacy and numeracy. This is one of the objectives that everyone should reach that level. But now you see that the levels are that not more than 30% of our children are able to achieve this. So this is something that will take a long time. Then also there has to be standard setting and accreditation for school education. That means there will be authorities set up on state level to which both public and private schools have to say get certified from, accredited from. This will solve the problem of both. This will solve the problem of teachers because now the teachers have to maintain the basic eligibility standards, and also the schools would also have to maintain the basic standards like student pupil ratio, like the say what are the basic amenities which have to be available. Then what is the basic standard of education that you have to provide? So standardizing that process. Then with respect to teachers, reform B.Ed degree, then NT examination for admission to B.Ed, because right now the admission is direct, do not have examination. A few universities do have examination. They do have examination, but generally you find that there is direct admission to bachelor's in education. Then there have to be teacher eligibility tests for both private and government schools. Because right now private teachers do not take up any kind of eligibility examination. Then this idea of elderly or the ones who are retired, mentoring from them. Then more autonomy to teachers in terms of how they want to design their curriculum, how do they want to proceed. But this again is ambiguous. How do they go about it? What is this aspect of autonomy that has to be provided? And let's see what comes in the future. Then assessment tests for the teachers. Also continuous professional development. These are the aspects which have already been covered. And again, there should be a authority that will standardize. There should be professional standards for every teacher. That what kind of hike promotion you'll get after the years, what has to be the basic standard of assessment, or say your score with respect to your professional skills and your knowledge, etc. So there should be a standardization in that aspect as well, because you find that it is highly fragmented, distorted across the country. That private schools have different standards, state governments have different standards, central government has different standards. So why not maintain uniformity with respect to this? Now with this, we have concluded pretty much our discussion on school education. The next aspect is higher education, which will be taken up tomorrow. And I hope you would not mind when I straight up towards the end, because these aspects have been discussed and you're supposed to go through them once. So yes, Deepika is suggesting that co-learning can also be a suggestion to improve learning outcome. Yes, so the activities that we are talking about, in the provided in the NCERTs, at times they engage teachers and the students, at times they engage students themselves. So yes, those things are there, but we have to promote them more and more. So we have to promote more of learning than remembering, right? So that is the difference. And I hope you are getting the idea. Oh yes, tomorrow is Saturday, and we will be discussing these aspects on Monday now. And I hope that everyone will go through the National Education Policy and the PPT till here. Try to go through the idea of higher education as well. What are the problems? What has the National Education Policy suggested? So that it is easier for us to discuss on Monday. Because now I and even you would want to discuss more and more questions rather than say discussing more of the factual aspects. Okay, so with this, let's conclude for today and meet again on Monday. Please do write the weekly test, which will be provided to you, so that you know whether whatever you're learning is actually helping you or not. Thank you, everyone.